Good morning, everyone. Welcome to our August 30th, 2021 regularly scheduled workshop. Before we begin the work of the district, let us stand for a moment of silence, followed by the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Well, good morning, everyone. We're excited this morning to bring to you some topics focusing on student achievement and some other important topics this morning. But we're going to start with some.
Before we start that, we're going to do public input.
This morning with public input, which is what I was just getting ready to say.
Oh, okay. Great minds. Okay, first, Mrs. Cronin.
Good morning, board members and superintendent. You know, last Monday's meeting had to be the worst, most unruly meeting I've ever attended. I do apologize for my outburst. But I sat here and watched this meeting unfold. It was supposed to be a rally of parents and staff, whether they agreed with masks or they didn't agree with masks. That's not what it was. It turned out to be a political rally, a political gain. You may not have had a mask mandate, but we should have had social distancing in this room. Signs and flagpoles should not have been allowed in this room. You had staff outside that wasn't allowed in. You would think you would want to hear for your staff. What was going outside was a disgrace. A Lake County School Board meeting. It was a disgrace when little kids were being picked on because they had a mask on. You had one parent tell you of what she went through out there, and she had video of it. Has anybody even attempted to see what her video was?
I did.
Thank you. I don't think anybody needs to be treated the way people were treated outside because they want to come in here and speak their voice about the safety of their children or their workplace. Thank you.
Mr. Yoakum.
Hi, Vance Yoakum, 12619 Milwaukee. I write the blog fiscalrangers.com. The previous speaker was from the SEIU union, and I think needs to be made clear. I believe that the staff here did a good job of going out there. They're giving out the forms to sign up. They didn't try to over-control the crowds, let the city of Traverse police do that when they showed up, because one of the Democrats that were here to raise a protest smacked one of the other people that was opposing it. I personally have an awful lot of information that I posted on my blog about why masks do not work, and even more is coming out. More is coming out about the need for early treatment as opposed to using masks and waiting for a vaccine. And you've seen the governor of the state come out now with monoclonal, advising that you use monoclonal antibodies as one of several well-known, proven by doctors, not scientists that are not doctors, like Dr. Fauci and others, that they work. And so I think that it was a good meeting. I've been to ones where other people are making political hay out of things and doing a lot worse than what's seen here. We've even seen, I've got videos of demonstrations that have been here organized by the political left. And so I'm just saying, I'm standing up to it. I don't want to be nice about it anymore because they aren't. They're killing our people. Dr. Fauci has, in my opinion. They're letting immigrants across the border and everything else, and I don't think those people deserve any support at all. And I would hope that the teachers that are educated would study a lot of the information that is out there about the early treatments for COVID and for the Delta virus, and they're working. They keep people out of the hospital. They don't even have to go to the hospital. So with that, again, I just like to commend the staff. I think they were out there, they were handing out brochures, they didn't over control or anything else. I thought they were very fair to everybody. And there was just kind of a natural dispute going on out there. And it's erupting because people are tired of the Biden supporters causing so much damage to this country that we need to stand up to them. Thank you.
Thank you. Okay. Please.
All right, so we're going to jump right into our topics today. We are going to start with a couple of district updates, things that either the board has asked us to look into previously that we want to bring a few of those topics back to you today. But we're going to start with Mr. Farnsworth. He's going to give you an update on the MOU that was signed last week with LCEA, give you the highlights of that, and so I'll turn it over to him.
Testing. Morning, everyone. Superintendent, board chair, board members. It's a pleasure to come before you today, just to give you some updates about some of the good work that's going on and collaboration between our bargaining units and their teams and our team here with the district office. Even in unprecedented times, we've kind of got a new fresh start of working with one another, and things are off to a really good start. We had really productive conversations over the course of a couple hour-long meetings, and what came of that is a memorandum of understanding on COVID-19 safety protocols, and we've signed off with LCEA. And that's not to say that discussions have not been productive with SEIU, because it was a joint meeting, but we've got a few more details to talk out, and we're scheduled to meet with SEIU again tomorrow at 10:30 a.m. So I suspect we'll come to agreement on some type of document for them also. Just keep in mind, as we're working through this, anything that's beneficial and not controversial to the process between our group and their group, we'll be enacting and taking care of our employees as far as where the real concerns lie, which is in the area of leave. So I've got some highlights on a few slides, and I'll just go over those, and you guys can feel free to ask questions, and a lot of them will be answered as we move through the slides, because some topics are related to others, right? So there were some standard things that I won't go over in the agreement, which just related to the same things we dealt with like last year, which is attention to cleaning, attention to PPE, making sure folks that are in those areas where there might be closer contact, because you have to deal with children, there's no way around it in a closer contact, making sure those folks have proper PPE and the things they need to feel supported in their environment. So those are some of the things I won't go in total depth over, and quarantine processes, because for the most part they're the same for across the district as far as quarantine processes, and people have seen those pretty well. The first is my first slide. Next one. There we go. PCR tests will be available at every worksite school for staff and students based on availability. You'll see that term "based on availability" pop up, because as we know, there's shortages on different chains of who knows what these days. So, but we're doing our best to make sure everybody has what they need from a testing standpoint. The key here is proof of a positive COVID-19 test result it must come from a PCR test at the work site or from a licensed medical provider. And that's really just to stand up to the validity of the test when we're dealing with things like leave and making sure, because there's such a wide variety of home tests that are hitting the market as far as when you're dealing on the business side of leave, and it reduces our opportunity for fraud. Then we have, next slide, compensation for contact tracing. As you know, we've got people working a lot of hours out of the schools and really doing a great job of contact tracing at the schools, and sometimes that works into the evenings. For the most part, we've got administrative folks that are handling those issues, but we want to be able to work with some of our other staff if possible to help with that, so everybody gets home in a decent hour and we speed up the process of reporting and things of that nature. So if they are working beyond their contract hours, then they'll be compensated at their hourly rate. Next slide. Just a little bit on quarantine policy. Something that differs a little bit is employees that have been vaccinated and are not exhibiting symptoms will not be required to quarantine if exposed to someone who tests positive. Very similar to what we're doing with students. However, they will be required to wear a mask for 10 days when working and maintain a 6-foot distance where possible. Proof of vaccination must be provided to employee relations. Next slide. Our remote work policy. This is a big deal because we got to keep making school happen when you have large amounts of quarantines and people in and out. So I'm very happy about this portion of the MOU. An employee who is quarantined and able to perform their job functions remotely may do so following discussion and approval from their supervisor. Any instructional personnel who must quarantine due to exposure to an individual who tests positive and is not exhibiting symptoms, regardless of where they are exposed, will perform their duties and teach through Google Classroom and the Google platform without having to use their accrued time. Next slide. Short-term leave. We got a couple slides on short-term leave, and this was a big deal because this answers the calling of what you guys, I think, the intended support that you wanted to give, and make sure that everyone's taken care of from the business side of their life while they're working for us. So, employees who have tested positive for COVID-19 are eligible for the number of hours necessary to cover up to 2.5 work week schedule, up to 100 hours before using their own accrued sick and personal leave. So those folks that have tested positive, as we've seen, there's the normal quarantine window, and there's some people that might be out for a few extra days, as symptoms start to subside. And we felt like with LCA agreeing on that 2.5 work week, gave some time for that. Next, personnel who quarantine due to direct exposure to a COVID-19 positive individual, such as a student or colleague, while acting in the course of their duties, are deemed unable to work from home, will be eligible for unlimited COVID-19 paid leave. This was a big point of contention last year, if you recall, because you had some folks that would go out on multiple quarantines, and then all of a sudden it was really digging in to their personal leave after we covered from what was required by the mandated executive action from the federal government last year. So we're able to cover them because it's, no blame on them for being exposed while they're trying to do their job. So that was a big thing for our employees, and I feel like that's very generous of us to be able to cover them in that way. Next is the short-term leave is personnel with elementary school age children or children 18 years of age or older and incapable of self-care because of a mental or physical disability who cannot attend school due to a district-directed quarantine or school closure can apply for LCS-dependent COVID leave under the same provisions as if their child had contracted COVID-19. That's the one that's a little more particular, and with all of this, it can be very confusing to the employees, so we're making sure we communicate out to them that any leave-related questions they might have, is directed to employee relations, and we're dealing with those folks one-on-one, all hours of the day, making sure that those questions get answered. Under that one, an individual, it's very similar to what they had for emergency FMLA last year, where it covered up to 2/3 of their pay with a capped amount, and this allows some folks to, be able to stay home with their kids if they need to. But if you think about it, how all these points work together, if it's an instructional employee and they're home with their child, they're gonna be working for us anyway, right? And they're not sick. We don't want folks, we need them to heal, but if they're sick, they're able to, or they're not sick, they're able to work anyway, so this wouldn't even impact them. And through the course of all of last year in that area, which I'm thankful for, this was the least exercised piece, but we felt like it was necessary to include it this year. So those are the highlights of the agreement. At this time, if you guys have any questions, I'll do my best to answer them.
I have one.
Yes, ma'am.
Is the dependent COVID leave retroactive?
That was very important. Anything that we've had so far in this agreement is retroactive to August 3rd, which was the first day teachers returned. And that's very important. And we've been, just so you guys know, we've been keeping tabs on all of this in the background to make sure that we did not have any employees fall into a leave without pay, to where it would hit them in the paycheck before we arrived at agreement here. And we were able to catch a couple scenarios like that to make sure everybody had their pay. And now we'll go through and handle that retroaction and send out instructions for how people in the school should handle the coordination of the leave.
Thank you.
What about, will you send this to us?
Absolutely. It is already posted on under the school board bargaining updates webpage. So you can click there and go
Okay.
to the link.
What about if their kids actually are sick?
This is
Like-
where I'm gonna need scenarios can be
So, like,
problem-wise. So I
right,
need
like-
a little more description.
Well, like, say you're home with a couple sick kids with COVID, it's kind of hard to teach. It's certainly situation dependent, but it depends on how old your kids are. Sometimes when you're home with kids, it's really hard to get away from them.
Yeah,
With
I
sick
agree.
kids.
That's when that dependent COVID leave would be something we need them to apply for, and we would work through them.
Okay,
The idea is we want to look at each scenario of each employee that's impacted by COVID, and then take them down the path that is most supportive for them from a support and resource monetary perspective.
And this document's solely based on our instructional personnel. This is LCEA.
That is correct. Originally, we had a joint document, but, their lives are a lot different, right? So we split out the document after the last meeting at the desire of SEIU, and we'll have another document that comes together and supports them also. But all these leave pieces, they're not something that we would be working against. Those aren't the issues that we're still discussing with SEIU. And if there are, we'll just retro those back accordingly if there is a minor change to them.
Okay.
Thank you, sir.
Thank you.
So I just have the next couple of slides, so if you'll just go to the next slide. While we are supporting staff and everyone in this process, we're also launching a new opportunity to support students. So we are launching Lake Assist, which is an opportunity for us to be able to tutor students or for students to get help in the evenings while they are on quarantine or if they are out due to a sickness with COVID. And so basically we are training people today, starts today. We're training our staff, onboarding some people. We had over 190 instructional staff willing to support students at night, which I think is a big testimony to the way our Lake County employees show up for students. And so basically it's an opportunity Monday through Thursday, every evening from 6 to 8, a student who is quarantined can sign up to have a personal opportunity to speak on Google Meets with a teacher and get help with their assignment. So the next slide kind of walks us through that. And that's basically just what I said. So if you go to the last slide for me,
basically, we've kind of given you this whole, what do I do when I'm in quarantine? And one of those is to go ahead and make sure your Chromebook is at home. And we have been communicating that students should have a Chromebook. They should be coming home with that. And then asking them to join their teacher's classroom, their Google Classroom online, and then have an opportunity to sign up with Lake Assist through a scheduling appointment link. So kind of took that algebra tutoring last year. I don't know if you remember that. We kind of launched that in the second semester and sort of expanded that experience and allowed it. And we're going to try it out for these kids who have reached out and said we need to talk to somebody about our assignments. It's kind of the early in the year, and so they felt like they wanted some support. So I feel like it's a really great thing, and I'm excited to see it. It will launch for students next Tuesday, the day after Labor Day.
Good morning. It's my pleasure to be here this morning to talk to you a little bit about the primary ways we've been communicating with our stakeholders about COVID-19 in our schools. Some of the things that we've been doing and then some changes that you can look forward to. Next slide, please. Our goal in communications has always been to make sure that we are communicating openly and transparently with accurate data so that all of our parents and other stakeholders can see the district as a reliable source of information about COVID in our schools. And we've come close to meeting that goal. Stakeholders are definitely seeking out the data, and we are answering questions about what they see nearly every day and sometimes at night. But they have raised some questions about the reliability of the data. And we have sought to reassure them, and I want to give you the very same reassurances, that aside from occasional and rare human error, we are posting accurate information. But our process has caused some confusion. So I'd like to briefly explain the issue that we're having, and then walk you through our current process, and then finally outline how we are planning to make some improvements. Next slide, please. So last year, we were able to maintain a spreadsheet of COVID cases in our schools and our departments with just one or two people primarily responsible for collecting and uploading that data. This year, the large volume of cases has made that difficult. So we reassigned 5 administrative assistants to the task, and we hired recently a COVID manager. And still, it has been a major undertaking. They are working diligently. They are posting all of the data. But the confusion arises when a parent gets a phone call about a COVID case at their school, and then they don't see the case reflected on the spreadsheet the same day, or sometimes not even the next day. So I'd like to take you step by step through the process and point out to you where those delays are likely to occur. Next slide, please. So here's how it works. A school learns of a positive case, usually when a parent reports it or when a student is displaying some symptoms at school and is subsequently tested. School staff then pulls the seating charts. Every teacher is asked to keep one. They use these to determine which students and employees have been within 6 feet or less of the positive person for 15 minutes or more, and those are considered our close contacts. Now, it's important to note that there has been some confusion about how we define close contact. Emergency Rule 64 DER 21-12, which was issued by the Department of Health on August 6th, says that direct contact means cumulative exposure for at least 15 minutes within 6 feet, even though the CDC's guidance on COVID-19 prevention in K-12 schools, last updated on August 5th, recommends schools maintain at least 3 feet of physical distance between students within classrooms. So you've got the rule saying 6 feet is how we define, and you've got CDC saying 3 feet is the updated guidance for distancing in the classroom. Parents have questioned why we are quarantining students based on the 6 feet in the emergency rule instead of the 3 feet in the CDC guidance. And there is an inconsistency there, but we believe that we are bound by the state's emergency rule. So moving on, the next step. School staff calls the parents of the close contacts so the students can be picked up and removed from campus to minimize the likelihood of the virus spreading. Now, this process can take a while if we can't immediately reach a parent. With each phone call, parents are given explicit instructions for quarantining, including dates and procedures for returning to school. Then, school staff also schedules what I call an FYI phone call to all of the parents at school to let them know that there has been a positive case on their campus. This phone call usually goes out the same day that a case is reported. Next slide, please. School staff then prepares a packet to send to the district office, including the names and dates. Typically, those packets arrive later in the afternoon toward the end of the school day, so school staff can send them all at once instead of sending them piecemeal throughout the day. So this is one reason that there might be a delay between a parent is notified by a phone call about a case and then when that case shows up on the dashboard. Now, we can cut off processing earlier in the day and just post what we have up until that point, but there will still be a carryover of what remains until the following day. The packets then go into a COVID manager inbox, and then the COVID manager and her team of administrative assistants pull from this inbox to process the cases. Once they pull a packet from the inbox, they check to make sure everything is complete and correct. Sometimes they have to look up information in Skyward or call the school and then wait for calls to be returned so they can get clarification before they fill in all of the blanks. This is yet another reason where there can be a delay in a case appearing on the dashboard. Next, the team creates a line list spreadsheet for each positive case on a DOH form. This spreadsheet includes the name of the confirmed case, date of the onset of symptoms, date the student was excluded from school, his or her last date at the school information, a contact person, the names of all the close contacts, including their date of birth, their sex, address, parent name, phone number, last date exposed to the confirmed patient, and date excluded. It's a lot of work, and it takes some time. They upload those forms into a DOH folder where there is a subfolder for each day, and then DOH uses this information to conduct contact tracing on its end. So at the end of the day, the COVID manager then creates a chart to summarize all the cases that were processed that day. How many positive, exposed, required to quarantine, not required to quarantine. Now remember, not every case reported that day is processed the same day. So it's not on that chart that summarizes. So this is yet another reason that there can be a delay in a case appearing on the dashboard. The summary is then shared with the board, senior staff, and with communications, who then uploads the numbers into the public dashboard. If the summary is shared before the end of the workday, communications can upload the numbers onto the dashboard the same day. But if the summary is shared later in the day, sometimes we've received them in the evening, after communications has gone home for the day, then the numbers may not be uploaded until the following morning. All staff is typically working late these days, but on some days, staff members are able to stay later than others. And so this is yet another reason why there might be a delay between when a parent receives a phone call about a case and when that case appears on a dashboard. So what do we do about the disconnect? Next slide, please. In the spirit of teamwork, our partners at Department of Health have offered to help us streamline this process. Next slide. Schools will continue with parent notifications and submitting the packets for the COVID manager to review, but the Department of Health is going to pick up the duties currently assigned to our team of administrative assistants. Once DOH processes the information and uploads it directly to their site, we will then share the information on our site. Our hope is that this change will lead to more timely updates, increased reliability, and more accessible data. And I'll show you what I mean by that in just a moment. We have had some discussions about linking directly to a DOH dashboard, but there are still a few lingering questions about that. So in the meantime, Dwayne Weeks and his department in IT have been working on a prototype of an enhanced dashboard that could look something like this. Next slide, please. So instead of just the chart that you see now, that can be a little difficult to read and to make comparisons, with this, ideally, visitors to the site would be able to see the data and easily make comparisons by date, by student groups, next slide, by school and district departments, next slide, and by staff groups. Next slide. So our goal is still the same, to communicate transparently with accurate data so stakeholders see the district as a reliable source of information about COVID-19 in our schools. And we believe that these changes are going to help us achieve that goal. That concludes my presentation. I'm happy to take any questions if you have any.
Are we checking seating charts for lunches and specials?
My understanding is that all of the teachers have been asked to keep a seating chart. I'm not sure about the cafeteria, whether they're at all grade levels keeping seating charts in the cafeteria.
Something to look at.
As she's saying this, they do talk to the students about who they were sitting around and gather that information at the elementary level. Again, because you have that cohorted group, they pretty much know, and I think they do have a seating chart specifically for lunch, but it's certainly something to look at. I know that there's a lot of contact tracing going on in our schools, are asking the right questions to ensure that they're getting all the students that are within that 6 feet of any positive case.
Also, there's been I think it's Duval actually did do a policy where they send an email to the classroom. So if Mrs. Smith's classroom is, so just so people realize, like, if I have COVID, Molly and Bill would probably be notified. Nobody else in the room would be notified right now in the classroom. So, like, parents are finding out afterwards through word of mouth, and they're annoyed. They're like, why wouldn't you just tell us that half the class was dismissed to be quarantined, but my kid wasn't in Miss Smith's class? So there's a lot of frustration there from parents that are finding out their kids are, because they would like to watch their kids, you know, and I'll just say this a lot, but Delta's different, and there's pretty good scientific evidence that 15 minutes for 6 feet is probably not good enough. So the parents at least want to know.
I think early on that there had been some discussion and some concern about privacy issues that perhaps we were doing the FYI call to the whole school, say, hey, there were 3 cases on your campus. And we were thinking that maybe that would be sufficient without having to say someone tested positive in Ms. Smith's class, and now everyone could focus on Ms. Smith's class and figure out who the person is who tested positive. So there was an attempt there to try to protect the private medical information of the people who were being diagnosed. But I understand the concern, and I've heard it from parents as well. Are there any other questions?
Thank you very much.
Thank you.
Thank you.
And I am next with a really quick update. Several months ago, Ms. Luke, you brought up a concern regarding the scheduling of the required 5-hour course for students for the mental health. And we heard from students that felt like it was too much. They were sitting in front of computers for a long time trying to take the course. And so I know Dr. Landry is going to reference this later, but I wanted to provide you with a great document that she and her team have worked on and that we went over with principals last week. And really just the short version of it is that they have taken the courses specifically to the 5 hours, and they have broken them up into 45-minute sessions. And you'll see on the back that each month has a specific focus. And so what the schools have been asked to do is to identify a specific day each month. So it might be a Wellness Wednesday, for example, that the school will, for this 45-minute period, all the students will go in, they'll complete the course specific to their grade level. And they all have the same focus throughout the month, and so there's other activities that are tied in. Our high schools are also able to use our peer ambassadors to help support the conversations that might occur during these 45-minute lessons, taking some of that off of the teachers and allowing the students to have more conversation. And so I wanted to thank you for that recommendation and let you know that we did hear you and that we have adjusted, and the information is contained on the sheet. And as I said, I think Dr. Landry may have mentioned it earlier, but I wanted you to have the information that was shared with principals last week. So
Thank you.
you're welcome. And now Mr. Ward has an update for you as well.
Good morning, board members. Can y'all hear me? Is this on? Is this working? It is? Okay. All right, just real quick, I wanted to, as Superintendent Corrigan said, we had an opportunity to meet with the principals last week, and during that opportunity, I did discuss with our principals some of the changes that we had made to the budget for their budgets at the school level this year, and also took the opportunity to communicate some of the concerns that the board had to discuss with me during our budget workshop. So they're now aware of the $10 per student addition. They know the board's intent is for them to use that to try to offset some of the dues and fees that they have levied in the past. We had the conversation about the dues and fees, and we also had some conversation about some of the FTE audit criticisms that we've been seeing in the past, so we can make them aware of it so they can correct some of those changes. And we just wanted to update you on that we did communicate those issues to our principals. And since I'm already here, we can go ahead and start the millage overview. The millage overview, my part, is going to just start going over the dollars, how much revenue we receive, and then how we allocate that out in our budget. So first slide. You can see the millage revenue this year is a little over $21 million. That is the 96% of the levy, which is all we're allowed to budget. And then you'll see the tax collectors' commissions, which by statute they're allowed to charge the 2% commission to offset their cost in collecting that funds for us. And then we have the charter school portion, which is a little over $3 million for the current year. And then the amount available to the district, which is $17.7 million. Next slide. So what do we do with the $17.7 million? I have in here listed the types of employees that we have, the FTE number, which these are rounded. Some of these employees are shared with other funding sources, so they may be a little bit different, but they're still the same number in each school. There's 40 mental health liaisons, one per school at our district schools, and that's a cost of $2.7 million. We have 40 past teachers, which is the positive alternative to school suspension teachers, and that's $1.9 million. We have 39 nurses. Again, we really do have a nurse in every school, but some nurses are charged to other programs, so partial nurses. There's $2.6 million for those. We have 23 psychologists that are funded out of the millage of $1.7 million, and then 17 social workers, which is $1.1 million. Next slide. As you're aware, we used to contract with Livestream to handle 2 of our school sites. And this last year, we stopped using them, and this is the first year that we're using Lake Hills Academies. So instead of paying Livestream to take care of our kids, we are now taking care of them through our Lake Hills Academy. There's approximately 58 FTE at those 2 academies, and at a cost of $2.8 million. Lake Success, which is our alternative school, there's 24 FTE, which is the equivalent of $1.3 million. Our district safety office has 3 FTE, which is $265,000. Student services have 3 FTE that are related to the supervision of the nurses and also the mental health liaisons. $247,000. So total salary and benefits in the district, there's roughly 247 positions at a little over $14.8 million. Yes.
Are the charter schools $3 million, are these considered restricted funds to them as well?
Yes, it is, and we do review that. We require the charter schools to submit a plan on how they're going to spend the money, and then we have them provide us the documentation showing that they spent according to their plan. We do that annually, yes, sir. And next slide. So some of the other expenditures that we charge, the portion of school resource officers that are not funded through the Safe Schools, we charge to the millage, which is about $2.4 million. We have some security software that we use at $197,000. And then our district safety office operating cost of $59,000. A lot of that has to do with the supplies for our school guardians. And then student services has some operating costs related to the nurses and to some of the other operations of the millage. And then Lake Success, our alternative school, which is $56,000. So our total operating cost is $2.8 million. You combine that with salary and benefits, it's $17.6 million. So we're pretty much budgeting the majority of the funding. There's about $119,000 that was not budgeted in the current year. But we, in our conversation with our principals, they brought up the fact that most of their walkie-talkies, which are related to safety, their batteries are needing replacing. So we are going to be budgeting them a portion of the funding so that they can replace the batteries in their walkie-talkies at their schools, so they can communicate when they need to.
$100,000 is a lot of batteries.
Yes, sir. They're expensive batteries. They're not quite your normal batteries. I believe they're a little over $100 per radio to replace the battery. Okay. Any questions on the money portion of the millage funding? Hearing none, that's my presentation.
Thank you.
I'm not sure. So we're gonna now, he gave you the money part. We're now going to go in and look at the services being provided through the millage funds and the impact on our students in our schools. And so we'll start off with school safety with Mr. Hankey and Mr. Mabry.
Good morning, Superintendent, Board Chair. Mr. Ward discussed the funding part of this. Mr. Hankey and I will be discussing specifically as it relates to safety and security services. We have various departments that we're presenting this morning, so I find it appropriate that we start with our overarching mission and vision for Lake County Schools. The mission of Lake County Schools is to provide every student with individual opportunities to excel, while the vision is a dynamic, progressive, and collaborative learning community embracing change and diversity, where every student will graduate with the skills needed to succeed in post-secondary education and the workplace. Specifically, the strategy statements we will be addressing this morning. Number one, strengthen facility security, procedures, and infrastructure, and that will be the highlight of our presentation. And number two, improve school-wide support for behavioral and social emotional learning for all students. And momentarily, Dr. Landry and Ms. Pearson's departments will be presenting more on the behavioral side of things. As it relates to our three-year strategic plan goals, obviously we will be addressing specifically goal number 5, to ensure a safe and positive environment for students and staff. And also number 3 discusses using the district resources efficiently to enhance the learning environment and ensure financial sustainability. So that's the basis of our presentation this morning, and now we will go into specifics as it relates to the things that we do in our department.
So the first slide that we'll have will be on Raptor, if they want to head over to that one. Raptor Technologies is a solution that we utilize at the schools for visitor management. Anytime that we have visitors on campus, we have to ensure that they're not on a sexual predator watch list or anything like that before we allow them on campus. It also gives us the ability to track campus visitors for any time that we have them on the property. That's important both for district staff and for family members, individuals, contractors, anything that's visiting the campus, specifically because if there was an emergency, a fire, anything like that, we can, with a couple of clicks, give them an exact list of every person that's on campus at that time, students, staff, and any visitors as well. So they know exactly how many people they're trying to locate, and we're not sending people into dangerous situations unnecessarily if everybody is already accounted for. You can see some of the statistics there of our visitor screenings. The past year we did nearly 30,000 visitor screenings for coming onto the properties and the campuses, whether that be through volunteer programs. As you can see there, we've got nearly 7,500 active volunteers that were processed through this system. This system is quite robust. It handles our visitor management, but it's also how we track the hours for the volunteers for the district. We're able to pull those reports, show how long people have been on campuses, what their time in has been. It also functions as our district's reunification process. So if we had a cataclysmic event at a campus, a gas main eruption, something significant happening that required us to move the entire student body to an ancillary location to reconnect them with their families, this is the system by which we process that, get them back with their families, make sure that a checkout process is handled appropriately. And also, we have a district reunification team that is my staff, Joseph and Mark. We would actually come out and run that so that the school-based administrators are able to work with their students, be engaged there, and aren't required to be handling that type of a procedure, because if it was a significant event, they could be considered victims as well, and it doesn't make any sense to expect them to process all of that procedural stuff while they're dealing with whatever trauma the students are as well. And then you can actually see there in 2021, 68 offenders were logged. It's important to also remember that oftentimes it might be the same person multiple times that will visit the campus if they have a student there or other situations. So that covers a lot of that. This also is the way that we maintain our statutory requirement for timekeeping and reporting for SROs and SRDs being on campuses. We created a special process by which we check them in and out while still maintaining their private data, which is protected, but it gives us a way to turn those reports over to the state every year quickly and easily, which has been a big benefit for us.
Question, can you explain more of that process? Okay, so offender comes in, we've identified them in Raptor as such. What sort of special protocols exist for that?
So there are a couple of them that exist. The first thing that's going to happen is it's going to pop up their image on the screen, and it's going to say that it's a close match. It's going to present the information that's in the database, and then it's going to present that person's image and name that was there. So it might be that the two images don't match, and immediately the school can say, oh, this is just somebody with the same name and birthday. They're okay. So it immediately allows them to do that, but at that same time, we register all the staff, as well as the SROs, SRDs, or school safety officers at that campus, and they all receive a text message and an email letting them know and alerting them that somebody has come on campus that was pinged. The staff can then let them know, yes or no, it's a concern, but it immediately lets everybody know what's happening. There are specific legal procedures, like we can't deny a parent access if they have a student there, but there are requirements that are worked out with the Sheriff's Department where they have to notify the school 24 hours in advance that they're coming so that they can be escorted while they're on campus if they wanted to eat lunch with little Timmy. And then that way we know that they're coming and we're prepared. If they just show up, they are not allowed on campus. Right. And I did want to cover, this was something that you'll see the other presentations that follow. This is the portion of what we do in safety and security that is based out of millage funds. This only represents a very small fraction of what our department actually does for the district, but we wanted to cover this in detail for everybody so they knew what was going on with these programs.
So the next piece is regarding behavior threat. I'm sorry. The next piece is regarding the emergency response information portal with safe plans. So all schools are required to have a safety plan, an emergency response plan. And we house those electronically in the ERIP system, also known as Safe Plans, because we are required not only to have emergency plans for each school, we're required to have a district emergency plan, and Alex referenced a reunification plan as well. This is our drill management piece because we are statutorily required on each school to have certain drills per month, whether it be fire drills, active assailant drills, severe weather drills, and this is the drill management piece for that, where the administrators will schedule that. They will conduct the drill. They will do the after-action reporting in this system so that we can, again, show compliance whenever we have to do our state reporting. It's all held in one database. Another important part of the Safe Plans or the ERIP portal is the e-learning component, because we are required to provide active assailant staff training each year. We have this component built in, which is our method, which is the alert method, assess, lockdown, evade, resist, and tell, where it is an online component, so staff can take this annually and update their certification. And again, that is a requirement under statute, and so that we can provide our compliance piece for the active assailant training. There are other modules in there that are not necessarily required, stop the bleed, emergency response, reunification, various different learning modules that staff members can take, but the one that is required is the active assailant, so we have that built into this system. In addition to that, this addresses the behavior threat assessment. This is something that has come about since 2018 with the Marjorie Stoneman Douglas Public Safety Act. It involves comprehensive school threat assessment guidelines. As you all know, we are required monthly to have behavior threat assessment team meetings, and all behavior threat assessments must be entered into a system and tracked so that we can develop trends on campus to see what is happening with a particular student or what is happening with school trends. It is a requirement that all members of a school threat assessment team is trained using the CSTAG model. That's Comprehensive School Threat Assessment Guidelines. Again, that is the state-adopted model for monitoring the threats that occur on campus. And we're talking specifically here about threats to others. Dr. Landry's group will be talking about threats to self with suicide ideations. So we have partnered with Navigate 360 in order to train all of our behavior threat assessment team members. In total, district-wide, it's approximately 440 individuals. So this year we will be training on level 1 and level 2. We will be training 220, and then next year we will train the same amount so that we have them all trained by the 22-23 school year, which is what is the requirement under the state board rule.
The next thing that we wanted to cover was the requirements for the state with Alyssa's Alert or Alyssa's Law, which is the new requirements. It's important to note we've actually been in compliance with that law since 2018 before it existed. This was one of the areas where we had really pushed the boundaries statewide as far as how we were handling school security. We actually had the Rave Panic app available through Mutual Link. We had that for several years, but as the requirement for the state came, so did a whole lot of new options. A lot of them were more robust or a better fit for our district, and so we decided not to renew Mutual Link this year and instead decided to go a different way. And to cover that would be the next page, which is Fusus. Fusus is actually a very interesting platform. It's actually something that we did in partnership with the Sheriff's Department, and I use the term partnership loosely in that we are implementing it, and the Sheriff generously offered to pay for the entire process, which was a really great thing to be in that meeting. But what it allows is that Fusus is their new real-time crime center. They're in the process of getting that deployed. The alert program, which is part of Fusus, will allow if an emergency occurs on campus, the requirement is that there has to be a way for the school to create some type of a panic situation which dials 911. What this will actually do is it not only allows them to dial 911, it sends GPS tag information, overlays it onto a map of the school, and immediately displays it on the wall in the real-time crime center at the Sheriff's Department. When it does that, it also locates where the teacher is on campus and begins populating their screen with all of our security cameras that are around that area so they can immediately assess, send the right type of response unit, and can be evaluating what's occurring while they're en route. They can then take that information and push it out through the Fusus Ops application to every responding officer's cell phone and vehicle, so that unlike some of the situations that we've seen in the past where there were shooting issues at schools and the responding agents were looking at footage that was very old, 20 to 30 minutes old, they will be seeing at about a 6-second delay, which is just how long it takes electrons to move around. But they will be getting real-time live camera feeds that they can utilize to assess the situation and respond correctly, and more agilely to make sure that their response is going to the right place at the campus to preserve life. And we have fully integrated this with them. We actually were able to work with Fusus's team and actually customize the application specifically for the schools. We'll be rolling out that update here in the next few months, which will actually give the ability to, in the event of an emergency, a teacher can turn the camera on their phone and stream that to the responding officers, which gives us even more camera coverage if it was needed. One of the reasons I wanted that is if it was a medical emergency, they can actually have that video showing exactly what's happening and be getting coached by an EMS response person or something like that on what they need to do to try and assist with stabilizing that individual until the emergency response unit arrives. So again, it was all about getting as much information as quickly as possible. So we actually far supersede, again, the requirements of Alyssa's law. We are kind of trying to stay out on the forefront and not just be compliant, but actually show people what more can be done. So this is a really incredible program that we've partnered with the Sheriff's Department to deploy. With RAVE, we had about 380 teachers and individuals in the district that had completed their sign-up process and actively used the application. We already, with just our first push-up drive, have nearly 800 teachers that have completed the sign-up process. We have another 1,500 that are pending that we pushed out something late Friday afternoon, so we should see a bunch more signing up today. And that was just with our first sign-up push at the end of last summer, where we didn't tell them what it was called or what it was going to do. This was just the purpose, and please get engaged, and we had 2,300 people in the district sign up to be a part of that program, which is just outstanding.
So another piece of the behavior threat assessment that I mentioned before, which is required in statute, is how we manage that. And so through the Millage project, we have utilized USA software for the past 2 years to manage our behavior threat assessments. This was done at the request, really, of our school-based administrators, who are the ones who input the data. Previously, we were using our student information systems, or Skyward, and it became a complicated process, and it was a lot of work on the side of the administrator to do that. So we partnered with USA Software to develop a program really specifically for us here in the state. This is primarily a law enforcement records management company, but they developed this with assistance from us, going back and forth to help implement a way to manage our behavior threat assessments. And this, initially, we were doing threats to others and threats to self with our student services department, but our student services department really had a better handle on threats to self than this system really allowed for, so we've kind of backed that out. So our administrators have been trained on utilizing this piece of software. We are in our second year of it, and it is rolling really well. And this is also where they house their monthly meetings to show compliance with that. Just statistically, in the 1920 school year, we logged 290 threat assessments, and then in 2021, we logged 216, a little bit of a decline, probably due to the pandemic and the lesser enrollment of students on campus. Now, we did see an uptick with behavior threat assessments over the past 3 years, but that's primarily because administrators and teachers are more aware and they're looking into things a little more. So it's actually a good thing that we are seeing a little bit of a rise with that. The next piece that we'll discuss is the parent notification system. And this is our mass communication system that I'm sure most people are familiar with. This is used at the school level so that the administration can communicate with everyone on campus, all of the parents and stakeholders that are connected in the student information system en masse. And it's also used at the district level to communicate information through phone, email, and text. And this is either general school information, district information, or emergency notifications. And so School Messenger is the piece that is used for that, widely used in our district.
On the School Messenger notification, I know that I guess a year or so ago there was kind of a push to ensure that principals were also sending the email transcript of their message out because of this School Messenger's notoriety to always cut off, and then you don't get the whole message. And I think that some folks were doing that for some time, but I'm not sure if that one maybe needs a kind of a revisit to ensure. Yeah, and maybe School Messenger is becoming a little more reliable because I haven't been hearing from as many folks that it's cutting off, but it still does on some occasion, and then they're like, well, hopefully it wasn't too important.
Right, I got you.
So.
Okay, that's something we can certainly address.
Also, I'm sure you have the same thing, but as a parent with 4 kids, I get at least 4 calls every single day, and if they can send it by text, it would or voice to text, like, I don't know if that's a possibility on it, but that's so much easier to glance at than
Sure.
sitting through 4 to 8, because it depends on how many call-outs the principals do.
Right.
And it really adds up, man.
Okay. I'll look into that with our communications office for sure. Thank you. Mr. Ward mentioned this in his presentation regarding the funding pieces of this. So we have a wonderful relationship with our sheriff's office. I was meeting with our state individuals over the summer at my state training and just talking about the connection that we have between our superintendent, our sheriff, all of our school resource deputies, kind of bragging about that here in Lake County. And they were telling me that you're blessed, because that is not typical around the state. So we are very fortunate to have a wonderful relationship with Sheriff Grinnell and his crew of school resource deputies. So a large portion of this millage project is within the Lake County Sheriff's Office and our municipalities for providing school resource deputies. We have 30 school resource deputies in our campuses. We have crossing guards, and I know that the Sheriff's Department is actively seeking additional crossing guards, and our juvenile court liaison is taken out of the millage project as well. And you all know that the deputies provide that initial and primary layer of safety and security. We have safe school officers in addition to that on many campuses. They provide the law enforcement support, obviously, and then the community relations. They really become part of the campus, and we would not be as safe and secure without them. And also, and the next slide will reference the municipal agencies. Just know that we do partner also, in addition to the Lake County Sheriff's Office, we partner with 8 municipalities in this district as well. And again, that is not the norm, and it is because we have law enforcement that do support our schools, and they believe in what we are doing, and they are primarily looking out for the safety and security of every student, every staff member, every campus, every day. And it goes into the evening hours that these individuals are working to make sure that everything is safe. So we do want to make sure that we recognize those individuals in all of our participating municipalities, as well as our Lake County Sheriff's Office.
So ultimately, that's sort of the extent of our thing, and we wanted to just make sure everybody knew Joseph is obviously the District Safety and Security Specialist. He oversees a lot of the reporting pieces, the compliance pieces to the schools. Functions as that first line communication between the state and our district when it relates to these items. I am the guy behind the curtain that makes all the systems work and does all of the technology-based side of that. So he deals with them on the behavioral threat assessments. My team makes sure the server functions. We have, and then Mark Palmer, obviously, who does school safety manager. He liaises with all of the different agencies and the deputies and really assists with making all that work really well. Covers a lot of the different needed things for making our department run, which is a small portion of the millage. And then you can obviously see the purpose for what we do. But we like it a great deal.
Well done.
So in wrapping up, obviously, Mr. Carr, our assistant superintendent, who oversees our department, and the 3 of us. But I do want to say that the safety and security on campus really happens on campus, and that's with our administrators, my school safety contacts. Please know that you are appreciated, your work, your efforts. We know you have a lot going on, but I assure you all that they are working tirelessly to make sure that the safety and security of campus is of utmost priority, and as well as the teachers and those who work with the students day in and day out. So we handle it from the district side of things, but it really happens, as you know, on the campuses. So we do want to make sure we appreciate those individuals.
You guys are doing great work. Thank you.
Thanks, sir. Thank you.
So as Mr. Ward mentioned, we do have 3 components to our millage funding, safety and security, who you just heard from, also school health and mental health, and then PASS, our alternative to suspension program. So now is, we're going to talk about PASS and give you an update on where we are with that.
Good morning once again, Board.
It's a pleasure to be here to bring to you an update on our positive alternative to school suspension. If you'll give us the next slide, please. Just a reminder that incorporating the PASS program, we really wanted to make sure that our students had the opportunity to maintain their academic progress, and that consequences relative to behavior didn't mean that they had to lose time away from school. So our PASS program does just that. It lets them maintain their academic progress, but it also helps them to learn those skills that are needed to manage those behaviors. So last year was a year like no other. We were happy to have our PASS teachers in our schools, and they still continue to collect data on our PASS students so that they could provide additional feedback and conversations. I know last year that was one of the needs that came up, that are we making sure we're pushing back in to talk to our students and ensure that they don't have those same consequences for their behavior, and have learned, so to speak, how to manage those things. So they did do those things last year. They also met monthly as a focus group. We did that virtually so that we could still bring them together, knowing that many of our teachers, just like our regular classroom teachers and support staff, they stretched to meet the needs relative to the pandemic. So some of our PASS teachers filled in and offered additional support in classrooms based on needs at their schools. They also provided opportunities for students to use their voice, give us some feedback on the program, and tell us the ways that PASS could continue to meet the needs of our students. They engaged in a lot more professional learning. They're responsible for the implementation of restorative practices on campus, and that has certainly helped with supporting the needs of our students and even our faculty in building relationships and maintaining harmony and being able to support each other on a day-to-day basis as we were going through some of the challenges last year. And then they even developed protocols so that our students on Lake Live, believe it or not, we had some behavioral issues there at times that needed some additional support. So they came up with some virtual PASS opportunities for our students that maybe didn't want to keep their camera on all the time or participate fully. So they were very creative, and they too provided a virtual option. So next slide. Some of the, oh, I'm sorry, one more. Yes. Some of the additional professional development opportunities that we're engaging in this upcoming year is the Reintegration Circles. And what students have told us is that sometimes we're participating in circles within our PASS environment, but then when we leave and go back to class, we haven't always had the opportunity to engage maybe with classmates or our fellow teacher where the consequence or the behavior occurred, so that we can be able to reintegrate fully. So we're looking at opportunities to maybe repair some of that harm that may have been caused to a class or an individual teacher, and have an opportunity for some of those reintegrative circles to happen. We're also looking at creating restorative student leaders, that our PASS teachers are working with groups of students that can serve as leaders and be able to integrate some of these practices and build some conflict resolution among their peers. We know that many times students like to have opportunity to talk to fellow students as well, and maybe not always the adults, but to be able to work through those and have some student leaders on campus. And then finally, asking students what they need, feedback with regard to the PASS program and how can we increase the effectiveness. Next slide. This is just an example of some of the virtual meetings that happened among our PASS teachers last year. Ms. Jakima Spratley, she's also here. She works directly with the PASS program and meets monthly with our PASS teachers, carries out all of the programmatic requirements of PASS. So our PASS positions are funded through the Millage, but all of the program activities and the resources come from our Title IV grants. So the next is next slide. And the one after that, because now we're going to look at some of our comparative data. So in our first two columns, you'll see 18-19 school year and 19-20. This is the data that I brought to you last year in terms of the comparison for out-of-school suspensions. Down the side, we have it organized by region, region 1, 2, and 3, and then the overall district comparison. And then the last three columns, we have 19-20 compared to 2021. So when we look at our out-of-school suspension, that really didn't change much in terms of the students that were enrolled in the percentage of out-of-school suspensions, roughly overall. just 1% less, from 4% of our students suspended out of school to 3%. And PASS was to be an option so that we didn't have to increase out-of-school suspensions. And so even last year, we really didn't see much of an increase there, stayed around 3%. Next slide. Based on our Title IV federal funding, we also have to look at our subgroups of students in terms of comparison of out-of-school suspension. And so 18-19 versus 19-20, we are still looking at how to minimize the impact for our male students, ESE students, as well as our Black students that are a little bit overrepresented based on their district percentages. So we look at ways to provide additional opportunities to our students to reduce that number and get it more in line with our district average. And then in-school suspension. So our past teachers work on that in-school suspension option. This data can be read the same way. First three columns, 18, 19, and 19, 20, and then 19, 20 to 21. And so we did decrease the amount of students that were in-school suspension. I believe a lot of that had to do with there weren't as many students enrolled, and then PASS wasn't open all the time because PASS teachers might be filling in for different teachers that might be out or supporting additional needs. So we had 5% overall less of our students actually in our PASS program. And then our next slide also shows we have the same disproportionality as it relates to our subgroup demographic data, which we'll continue to support. Next slide. So out of the 3,782 students that were in the PASS program last year, so the percentage of students served on our top left, 54% of those students were there for their first time. And so that's what we would like to see, that hopefully they benefited from the program, and more than half of our students ended up supporting their needs through PASS and then back into their general environment without having to return to PASS. About 20% were there 2 times, and 3 times 10%, and then we had about 16% that had more than 3 times that they were supported through the PASS program. Right underneath there, out of the students that were in PASS, most of them were face-to-face, the majority, 3,510. And then we had about 26 that were unmodified and 21 in virtual. That 6 that was NA could have been they moved from virtual back to the school or were modified and moved back. So at one point in time, they were reflected differently. So those are those 6. So how do we utilize our PASS teachers other than in the PASS classroom? And so our teachers that are our PASS support have been very instrumental in supporting additional pieces on the campus. So in surveying those teachers, many of them, the most, are helping to lead some restorative circles, whether that's in the classroom, in the PASS environments, or even with teachers sometimes. And then the other 2 are providing interventions, the top. So they may be providing the behavioral interventions, working alongside the MTSS supports in their school, and they are also pushing in during that academic intervention time, or even pulling out students during those windows of opportunity to provide some additional support when it's all hands on deck. Other things they reported, like leading PBIS, providing that lunch bunch support and remediation, mentoring students, data chats, helping to onboard new students, and peer counseling, and then substituting. So we want to also show that when PASS is not occurring, they're also being a support on that team, whether it's academically or behaviorally, as many of them are certified teachers in whatever content area as well.
Can I ask a question before you go to the next
Sure.
slide? So the only part that I would question or have an additional question that I don't see in here is, if one of the things that we kind of talk about, and I see even in the other things that they're doing outside of their PASS classroom, is like providing interventions, and we have these first-time students that are, instead of going out of school, they're staying in school, they're keeping up with their work, are we seeing that they're not falling behind in their coursework, or that their grades are improving? Is there any correlation that we can find or look at to them being more successful academically because they're not being suspended out of school, they're staying in school?
Yes, we asked that the PASS teachers also serve on their EWS, the early warning
Right, I wrote
signs
early warning
support.
signs down.
Yeah, and so one of those things that they're tracking, and as they meet monthly with Ms. Spratley, those are the pieces that they are looking at. because it's not just are they in there keeping
Right.
up, but is it ensuring that the students are not falling behind? And so
Right.
that's first and foremost that priority, that we want them to maintain their academic momentum.
Right.
So we have seen that, and as I get further in, you'll see some of the comments in terms of the feedback that students gave about how important being able to stay in school contributed to them being able to finish. Because we also saw in previous years where students missed time and missed work once they had a 0, some just checked out.
Right.
Like, I cannot, even if I made all A's from here on
Right.
out, my average is not gonna make me pass the class.
Right.
So we do talk to them as they're going into that PASS program to say, this is an opportunity that you don't fall behind, so that they understand as well that once I fall behind, it's even harder to dig your way out of that hole. So take advantage
So we would
of this
expect an
opportunity.
increase, right? We would expect an
Yes.
increase in school and decrease in out of school, and then that support system would hold their
Right.
positioning. Okay.
And so as well as tracking Ds and Fs, so we also have that same kind of committee working together to track the Ds and Fs of students to see who is falling behind, who's also been in PASS, who's also been absent.
Right.
And so absenteeism contributed greatly to a lot of the falling behind last year. And so,
Well,
yeah,
under,
yes.
yeah, got it.
Yes. Yes, ma'am.
Is this working? Because as she said, the suspension should have gone down, but they didn't.
The out of
the out
school
of
stayed
school
pretty
did.
much the same.
Yeah, they
Yeah,
stayed
and
the
our
same.
in-school
and-
did go down.
Well, no. I think, to be fair, you have to go back to the origin of this program, right back in 2018. When we just compared this against last year, you say, yes, that held steady, but when we go back the year prior, you see the 8% versus 3%.
Right,
Do we?
Yes.
right.
Do we not?
Yes.
I thought,
from
I thought I saw a decrease in out of
18,
school.
19 to 19, 20? Oh, and now we're holding.
8 to 4.
So
Right.
you go back to the 18-19 year, we were at 8%, now we're at 3%. So,
Oh, okay.
Yeah.
I didn't
Right.
see. Fair enough.
so there was that
Okay.
initial significant drop.
Good, okay.
And in-school suspension is also down.
Right, and a lot of
So you
what
got
they do
both.
is lead some of the techniques and behavioral strategies so that students aren't going out of the classroom. So they lead restorative practices, they give some additional supports, and so teachers have a better way sometimes of coping and dealing with some of the consequences, so that the most severe are the ones that we're seeing going into the PASS environment. We want kids in the classroom, not out of the classroom,
Right.
even if it is in a positive behavior support, so.
And then I guess the other question is, are schools like having to choose, well, obviously they're having to choose if they do substitutes, but like if there's a lot of pushing in, then is there is there a PASS program there? Because then that teacher can't be pushing in. So then are they saying, like at what point does a principal decide, like, no,
On whether
you're gonna
to-
do PASS now and stop pushing in because now I have 3 kids in PASS, or I have 2 kids in, I don't know how many kids make a PASS teacher be a PASS teacher versus a push-in. Does
Yeah.
that make sense?
They do, and I think every school does it a little bit differently and on a day-to-day basis. If you're assigned a pass, then we need you in pass. And sometimes they may be assigned for maybe a certain number of periods as opposed to the full day, depending upon that case-by-case situation. So maybe if a consequence really was specific to whatever this class is, maybe you're in pass for that period, as opposed to a consequence was deeper and had more school-wide implications, you might be there for the whole day. And so we let them make that decision on how that works.
I have a question and a comment. My question is, the lunch bunch remediation, is that something someone like me might call lunch detention?
Well, I think most of them are trying to use it more as a, let me sit with you at lunch and we'll have a mini circle group
Okay.
around how we can improve our behavior. Not a work duty type of,
Okay.
let me pull you at the time. No, we want
Okay.
them to be able to help students with their behavioral supports and not consequence in that way. Mm-mm. No.
And my comment was, when talking about out-of-school suspensions, we have to always keep in mind that there are certain actions that are not qualified as an in-school suspension
Yes.
thing. So, sometimes you do things that require that you go home.
Yes.
And the second thing, as far as past teachers pushing in as a substitute teacher, I just want to make sure that everyone understands that I don't think there's any principal who decides my past teacher is going to be a substitute. They do that on occasions when no subs can be found or someone gets sick. I don't think they're being utilized as subs, so people would have to decide, whether you're going to be a past teacher today or a substitute teacher today. So I think they're used in emergency situations. So I just
Yes.
wanted to be sure we all understood that.
Yes, ma'am, Ms. Cunningham, that's absolutely correct. I
Okay.
think secondary was a little needier last year because of the schedule and not having people that were off. We had everyone teaching during, what would necessarily be a planning. So, yes, they jumped in just as everyone else. At the same time, we want to maintain the fidelity to the program as much as possible.
Thank you.
Next slide.
So, I'm interested in some of that data about the multiple times. Can we pull that
Sure.
pie chart back?
Can you go back to the pie chart? Thank
So
you.
now this doesn't mean that they've been assigned to pass 2 or 3 or more times in a single year, but just in the lifetime of passes?
No, this would be for last year. Out of
Or in
the-
a single year?
Yes.
Okay, so, because for the district, for in-school suspension, it says 1,196 students. So, okay, so we're counting, so in one single year, obviously, it's not 3,782 unique students. Some of these are multiple.
Mm-hmm.
Okay, so 3 or more times in a single year, they're being in-school suspended.
It could have been, that could be for 1 day, could be for 3 days, could have been 4 or 5, yes. That a student has had another behavioral consequence and past what was utilized, yes.
So I guess my concern is almost half of the students in there are repeat offenders.
Yes.
So I guess I'm interested in learning more about what we need to do to
Yes.
decrease the number of repeat offenders.
Absolutely, and that's why those follow-up activities that, like such as the lunch bunch or additional behavioral supports, but yes, around, just a little less than half have been there 2 or more times.
And okay, so I think to put this in perspective, I'd be interested in seeing this same graph for prior years. For instance, in 1920, where we still have 46% were repeat offenders.
Yeah.
Was that higher? Is it moving in the right direction, or is it not moving in the right direction? I just don't know in the context of this to know whether or not we are.
Yeah, we could certainly get that data to look. We did present this last year as well, so I can go back and pull that to demonstrate a comparison as well. Yeah. The thing to think about is they would have been away from school.
Right.
And so we're happy that they were absolutely getting support from the past teacher and being able to not have to leave and lose academic momentum.
Sure, I think that's one step, but now the next
Yeah.
step is, okay, we're keeping you in school, but almost half of you are going to come back and do this again, and maybe again. So I guess that's the other piece. The next level is, okay, now let's try to, now that you're in school, let's try to reduce the number of times you have to go through this and keep you in your classroom, right?
But keep in mind, you're reprogramming some of these kids.
Oh, sure.
So
I
I don't
get it.
see it being repeated. I see it almost like you're building still. I don't know that a past experience is going to fix
And
it.
that's where I think the context of this over the prior year would help, that, because if in the prior year, 75% of the kids were repeat offending, and now you've only got 46% repeat offending, then you see that, okay, we're making
got
some
it.
major
100%.
difference here. But if the number of repeat offenders is going up, that's where I'd have some.
Where does our Lake Success Academy fit in? Because we still are sending 10,000 kids who we know that when they go out, they're not learning. So I thought that this, or is a portion of these kids at the Lake Success.
No, these are just at all of our regular school sites. Lake Success being our alternative school site where students are expelled from the school for a different reason. Now, Lake Success does some of those same supports, but they don't. You can look at them kind of as a past program in itself.
That's sort of but it was for the next tier up. It was like
Yes.
the more,
Yes.
which is these 411 kids, they obviously were more than pass in school, but less than, so do we have an area that we're sort of missing kids?
Well, for these
I
students,
don't see any-
something is, it could be repeated disrespect that maybe got them into pass versus a zero tolerance that would take you all the way out of school, if that makes sense. Could have been a,
Well, no, I get what we're doing at Lake Success, but what would take you in between? So you have a pass that you're getting in school. Then we have Lake Success that is for the next to being expelled, right? With the intent to reprogram and reintegrate them into school. So the 411 kids last year are sort of in between.
well, I don't know if they're in between. I mean, they're.
What support are they getting if we're sending them home where we know they're not getting support?
Yes, and so some, like as Ms. Cunningham said, there are some infractions that they have to go home. We also have past teachers, though, looking at students that are out of school suspended, so when they come back, one of the goals that I showed on the earlier slide was that reintegration circle, that we don't want them to just go out. Now, you had an out-of-school suspension, you're returning, and no one has had any communication with you because you didn't technically qualify for the in-school option. So we are asking that past teachers look at those students too, so that when they come back, we have an opportunity to meet with them about reintegration, so that we're still talking to them about the behavior, the consequence, and bringing them back in. So they do that type of support too, and they've been getting some professional development on that, because that is a skill set to be able to work with students. So we're trying to cover all of those bases and look at how all of our students are moving between each of these phases, knowing that the best place for them is to remain in school with the supports that they need.
This is amazing work, by the way, amazing work.
When these out-of-school students, or out-of-school suspended students return, is that an ask or is that an expectation that they're being met with and?
Yeah, right now it is a recommendation.
All
And
right.
we haven't made it a full expectation just because of some of the needs with regard to COVID and filling in next year. So the support this year is about making it more of an expectation so that everyone knows how to do it and it's doing it.
Yeah, I'd love to see us be able to provide the resources to get to the expectation type level, as there are these 1,500 kids where, I don't know, is it, here's your out-of-school suspension? Okay, great, now I don't have to worry about you for 10 days, and then you come back,
Yeah.
okay, here, go to class.
Yeah. And building that culture on each campus so that we value that we want to make sure that we reintegrate everyone as they come back. So that's part of their support as well, as a community, that we believe that we want to do all of those things and bring our students back in that way. And so they've been very instrumental in helping to build that culture on each campus as well, so that we know that our students really need that reintegration time.
I have one more question.
Yes.
Are we looking at our retention of our past teachers? And so what you just said kind of triggered that, as far as they're developing a culture on their campus, and it's important who we're choosing to be in these roles. And so are we looking at consistency?
Just like we do with any other position, absolutely. And we have had a bit of turnover, some for moving on to different administrative positions or even some district work. And so it's just like any other position where we are onboarding and then supporting those that have already been there and creating some opportunities for mentorship. But
Right.
yes.
Right, okay. I just know that's important. And I do want to say, like, because we're talking about some of the data from last year and this year, like, I just keep thinking about the state of schools with COVID the last year and this year even. And I just don't know, I don't know how we look at that data from a perspective of, is this program effective or is it, I just don't know how you evaluate a program at this point in the world that we're living in right now. And so I think we have to continue. We wanted this work, and we know this work is what's good for kids. And so as we continue to analyze, are we having more kids that are being supported? Are we seeing their grades improving, these early warning signs decreasing, or we're not identifying as many students because they are getting supports? I just feel like we have to keep that into perspective, because I think it's easy to get into the, is it working? But we don't even know if they're there. Like, they're quarantined, they're not in schools, they're out of, there's so much going on, and there's so many things to consider. And even the substituting with the past teachers, like, I know we're just trying to get people in buildings right now because of quarantines, and so that's just kind of laying heavily. And thinking about even just the divisiveness of our culture right now and how we're having kids dealing with each other. And so the benefit of the program, I think, far outpasses some of maybe what we're seeing in the data or not seeing for the next year. That's all.
Thank you. So if you'll advance a few slides, one more please. These are just some of the pieces that we got as far as feedback from asking students to kind of do like an exit survey. Some of the things our students have said that, what are the students saying about past? Well, that it reminded me that actions have consequences and I need to think before I act, right? And that's what we want our kids to walk away with. By teaching me to make better decisions, past has impacted me because it showed me what I have to correct and do to be the person that I want to be. Help me realize I need to be less impulsive, think about the outcomes of my actions. And so we want our students to be leaving in a reflective mode, not just a consequence mode of, I did this, I did my time, I come on back, right? We want them to be thinking about how can they change their behavior and how did their behavior impact others and what should they do the next time that they're in that same situation. And so without these individuals, that type of reflection would not be occurring. Unless they had a parent at home that might be taking them through that reflection. And I could tell you with my own kids, usually the reflections about what you're not gonna have and why, and you better not do this again, is not necessarily the type of reflection that's gonna move them into that. Because as a parent, you're emotional when your student has to come home for a behavioral issue, whereas our past teachers are able to kind of be that go-between and have students reflect so that the next time, wherever it might be a trigger or something occurs, that they can make a better decision. And so our students have felt very much supported. And so our last slide is just a thank you to the community, especially because the millage dollars help to pay for this position in our schools and support the needs of our students. And of course, Ms. Bradley for really leading this work in the district, and to you all for voting yes to make sure that we had this work. So thank you so much.
Well done, thank you. Any other questions or comments?
I just comment, just to follow up, I really didn't see that 8% to 4% when I asked that question, and you had said we're holding consistent. So I completely support the program. I didn't want, I just was like, oh, I was really surprised. That was really just a surprise response. I really do support what you're doing.
Yes, thank you so much. All right.
Next. Hello, Dr. Lang.
Do we need a break? Do you think we need a break? Or keep going?
I'm sorry?
Do you think we need a break? Does we need a break, or should we just keep going?
Everybody good? We're good through you, then maybe we'll.
Okay.
So you have 5 minutes.
You did see my slides, right? All right, I'm trying to share my screen here. Wow, look at that. Wonderful. Thank you. So good morning, Superintendent, Chairman Mathias, school board members. I'm so happy to be here this morning as a part of this team to bring you data and outcomes specifically for me, for mental health liaisons, and for nurses. I want to clarify one thing before I begin. Last time I was before you, we talked about the mental health application. Remember that very narrow part of our plan that had to be approved by the state and approved by you as well. I told you at that time that that's a very narrow focus compared to our overall plan. So what I have done for today is attached our comprehensive plan for the 2021-2022 school year for your review, and that way it could be out there for the public review as well, but I won't be talking about the plan for this next year coming up. Our plan from the previous years is very similar for this year coming up. And at the end of this outcome report, I'll be talking with you about a few next steps and lessons that we learned. So I just wanted to make sure that you know that that's attached and that I won't be addressing it today. So I want to start by putting the services of our mental health liaisons in a little bit of context for anyone who may be with us today, who wasn't with us in previous years, like Mrs. Cunningham. The Marjorie Stoneman Douglas High School Public Safety Act was the original mandate for all districts in Florida to create a comprehensive mental health plan, and that happened in 2018, 2019. The main goal of the mandate was to increase student access to mental health services. That very first year, we only had funding from the state, and so the way that we rolled out the program was I hired 6 district-level mental health professionals, 2 for each region, to help create and oversee the program across the district. At that time, principals were asked to designate a mental health contact on each campus, which was typically a school counselor. It was very difficult that first year because what we did was we put the responsibility of mental health services on top of an already full plate for the folks who were in our schools. That first year, we expanded and focused our relationship with LifeStream, and we began the collaboration of our very large work group called the Continuum of Mental School Mental Health Services. The next year, in school year 1920, our wonderful citizens here adopted a 4-year 0.75 millage increase to support student safety, nursing, and mental health. These funds allowed us to do all of the things that we are talking with you about this morning, including the hiring of a dedicated mental health professional for every school and a nurse for every school. And I just want to pause for just a second to share my gratitude and my respect and my love for these dedicated and brilliant professionals. This work is their passion, and it shows. Because of this phenomenal workforce that came into play in the 2019-20 school year, we were put in an amazing position to deliver never-before-seen levels of direct services to children, and we did it that year. And I'm so honored to work in this district where the voters care as much about our students' safety and mental wellness as I do. The next year, which was last year, COVID had entered our lives and everything had to shift. My team very quickly developed a distance learning plan for mental health services that provided support to students whether they were on the campus or learning at home. For example, Google Classrooms became a popular vehicle for maintaining supports, and LifeStream began moving to telehealth services, so they were able to continue their services as well. Also, during that unusual year, we successfully delivered the 5 hours of mental and emotional instruction for students. We brought the You're Not Alone Peer Ambassador program to all 8 high schools and engaged in district-wide training for crisis response. So the outcome data that I'm going to show you here this morning is from that school year, last year, school year 2021. Since the inception of our program, the mental health framework has been based on 6 overarching principles, and I'm going to give you at least a little bit of information and data from each one of these areas. So we have intervention, collaboration, crisis intervention, parent and community awareness, professional development, and program development. Now, program development is so critical for us because it's very important for us to have all students in all schools have access to the same kinds of services. So those students in our schools in the north part of our district have the same access to direct, indirect, programmatic, and high-risk services, just like all the rest of our students in the south do. So it's very important to us that our program looks very similar across the district. So our first major undertaking is intervention. As we've talked about previously, it's the expectation of our district mental health plan that all schools have at least one Tier 1 program to support mental health, wellness, and awareness for all students. This slide demonstrates that schools have lots of choices. Not everyone will choose the same Tier 1 program. Principals and their team will decide what works best for them. Also, I wanted to point out on this slide, throughout my PowerPoint, you'll see this little graphic on here that has a sky, and it says expectations. And I won't always touch on it, but what it signifies is that this is an area where we require these school-based plans to reflect the district plan. So again, it's just kind of reinforcement that we're doing something similar across the district in every school. So this is the Tier 1. One strategy for delivering Tier 1 supports is at the classroom level through guided lessons. This data really highlights on this slide how much this strategy is used by elementary schools. So from the 2019-20 school year to the 2021 school year, you see a big increase in the number of lessons at the elementary level from 674 to over 1,000. Also, you'll see graphics as I go through these slides. In the annual report, there are lots of individual stories and successes from schools, and I've just peppered my presentation with some of them. So here we have Cypress Ridge Elementary's mental health liaison doing a presentation on the book Chrysanthemum. And if you want to read more about that, it's on page 3 of the annual report, which is also noted throughout my presentation.
Why the drop in middle school? You've got a significant increase in high school and elementary, but pretty significant drop in middle.
That is something that we have talked about, and possible contribution to that is that we had 2 middle schools that lost their mental health liaison, or they were inconsistent at the school because of health reasons. For elementary school, Sanford Harmony was a very popular choice, and you can see an increase here in classroom lessons from 1920 to 2021.
Those questions actually really good, because all of those programs that you listed, and I've looked at Sanford Harmony, like, I had a meeting with one of their representatives years and years ago, and they're really not designed for high school, are there?
Sanford Harmony?
That's what he told me.
It is not, it's elementary only. I'm
Yeah,
sorry if
right.
I didn't make that clear. Yes.
Right, so these programs, like, all the ones you listed, the SEL programs, aren't intended for middle and high, really, so.
Yes, many of them are.
Do we have ones that are available for high school?
Sure. So You're Not Alone is a peer-based program, and that is happening at all of our high schools.
Okay.
Start with Hello can happen at any level. Zones of Regulation is another amazing program that can happen at all levels.
Okay.
And
okay.
you'll see more data as I go through that'll show you.
So we have the programs, we just
COVID and yes.
Okay, I just didn't know if we had the programs. I knew they were available for
We
elementary.
do have lots of choices.
Okay,
Yeah.
thank you.
Sure. So, for example, Start with Hello comes to us from Sandy Hook, and it teaches children just in general how to be more socially inclusive and connected to one another. And this last year, we went from 6 schools implementing Start with Hello to 17 schools. So, schools are kind of realizing and coming to try different things and seeing what works best for their campus. So Zones of Regulation is very popular across the district. It teaches students how to identify and regulate their emotions, and it was used at all levels. There are several wonderful examples in the annual report, but there are a few here from Oak Park Middle, Pine Ridge Elementary. The second school year in a row, we were mandated to provide at least 5 hours of mental and emotional health for all students in grades 6 through 12. On this slide are the 10 areas that by statute must be covered in our instruction. This is a little bit of data of how the instruction this last year was rolled out. As the superintendent talked about, we have certainly learned from our data and the feedback from our stakeholders that we want to try some different things, but that's how it was rolled out, how individual schools chose to implement. We did want to get feedback from stakeholders. So one group that we asked were teachers, the facilitators of the instruction. The feedback was pretty mixed. One thing that we asked teachers was, how beneficial do you think the material was to the students? About 63% of the teachers who took our survey reported that it was beneficial for students, which is down a little bit from last year. So at last year, it was about 70%, and so this year it was about 63%. We also asked students for feedback. One thing we asked them was to rate, this information helped me have a better understanding of mental and emotional wellness. So the key here is helped me have a better understanding. And from the data, what you can see that is the vast majority of students really at each school felt that it was helpful. There were lots of anecdotal stories of students really loving the engagement and the conversation around these issues. So there's no doubt in my mind that the instruction is valuable. I think that having it implemented more consistently across the district is really going to help.
Can I ask a question on the previous slide? The previous slide isn't in the handout, is that right?
It is. I think that it might be a few slides.
I think it got out of whack because I found it over here. I had to go back.
So that one says out of 230 responses. So is this like a just voluntary survey?
The teacher feedback?
Yeah.
Yes.
Okay, and then would the same be true then of the student survey? So like of the students who responded, 92%?
Yes.
Okay, and do we know what that percentage of students who responded versus who took it?
I do. So there were about 17,000 students who did the instruction, and then it would have been about 68% of them completed the exit ticket and survey.
Okay, thank you.
And the 230 teachers, that seems really, really low.
Right.
That we've invested so much in the detection, intervention, and maybe they need to realize how important we view it.
Yes, sir.
Because the only way to improve is if you get feedback, right?
Yes, sir.
Well, and to your point about having, when I looked at the slide that talked about how they intervened or how they implemented, I apologize. I'm not going to be able to find it, but where you said that some of the schools did it in one day, right here. Some of the schools did it one day. So when I was just adding those up quickly, you had about 55% of your people that did it in a short time period, and then there was about 50% that did it over a span. And so then when you say like 68% of them responded in a positive way, that correlates that the ones that maybe had it over time in the conversations are the ones that had a positive experience. So that's why I was wondering the population that responded, and that I believe that could be a variable that impacts the productiveness.
I agree.
So
That's why we're doing it a little differently
Right.
this year, and we'll hope these numbers prove us out next year.
Right.
And also, Mr. Mathias, I did want to point out that not all teachers were facilitators. So it was only the teachers who actually facilitated the instruction.
Oh, I thought it was all teachers, sorry.
It's not all teachers. Many of them. 230 is still a low number, in my opinion, but it's not all teachers.
Got
It's
it.
not that dismal.
Thank you.
it's on the
Very
green
very
slide.
top of the-
No, it's not. It's on the couple slides back. Yeah.
Okay.
It's that slide, but it's out of order.
With the new plan, with the handout, with the new plan, where it says that it'll be spread out for 7 45-minute sessions delivered once per month. What's the plan for the teachers? Is it every teacher that's going to be delivering that now, or?
So my team is going to work with each individual school to determine what works best for them, because, the makeup of support and how they roll out like their intervention block is very different on each campus. So we have created PowerPoints for middle school and PowerPoints for high school in terms of sharing the content with the teachers and helping them with facilitation. We're actually going to be doing more role modeling and practicing of facilitation with the teachers this year so that they become more comfortable. Another change that I did actually want to say right here is last year, the facilitated questions came from Purpose Prep and Ingenuity. They were kind of standard questions. And that was some of the feedback we got, is that the teachers were pretty uncomfortable with some of the questions. So what we did this year was my team created all the questions. So they're organically created from the content and from the what we know to be what students and teachers are comfortable talking about. So we're hoping now make a difference too. This is such a big planning event. It takes up so much of our time that we really want to do it right. And it can have so much impact on our students. So we really we tweak it every year, and this year we got some gold this year. An important part of our mental and emotional health education is that we use it as a vehicle to deliver our universal screener. This might be one of the more important reasons that we actually do this education, is to put us in touch with students who might need our help. So again, there were 17,000 students who participated in the instruction, and about 69% of them completed the exit ticket, which included the universal screener question. We want that engagement to be close to 100%. So we missed 30% of the students did not fill out the exit ticket. I'm not sure why. We're talking about that. We're looking at the data, talking to school administrators. But in order to have a successful universal screener, you got to have close to 100% of the students responding, okay? So we do know that was a weakness this year. About 8.6 of the students filling out the exit ticket requested to see a mental health professional. This was down a little bit from last year. Last year, we sat at right about at 10%, and that's what you would expect for a large group of kids, about 10% to require some additional help. So that was down a little bit this year, which I think is positive, to 8.6. So I think having it be the second year, some kids were already used to it. Here's what it is, and we're going to talk about it, and I don't have as many questions, and so they didn't request to see a mental health person. I'm glad you don't see my mail coming up, because that's what's happening on my screen. So of any student who requested to see a mental health professional, all of those students did get seen. 19 needed additional support, either through on the campus or through therapeutic settings like Livestream. And, actually, that was 19 needed a risk assessment, and then only 6 needed additional help. Here's the actual universal screening question. We asked students to rate their own mental health, and on the exit ticket, remember the number of students who took it was about 1,000. No, that's not right, hold on. Let me make sure I get you the right information. 11,000, not 1,000, 11,000 students took it. About 3% of them rated their own mental health as poor. And so any student who rated their own mental health as poor was seen by a mental health professional within 24 hours. And of those students, 71% of them needed an additional referral for support and help. 12 of them needed a suicide risk assessment, and then only 1 of them actually needed a Baker Act. So the good news from our universal screener is we touched 17,000 students, and only 1 student was in need of a Baker Act. The rest of them were able to support them prior to having that kind of an outcome.
I think it's appropriate to say it only took 1 person at Sandy Hook. It only took 1 person at Parkland. So we may, you never know, but reaching out to that 1 may have saved kids. That's how I read it.
Thank you. I agree. I feel like we touch lives and save kids every day.
Okay.
You're Not Alone, again, is that peer ambassador program that the students love so much. And in the previous year, in collaboration with Be Free Lake, we had 111 students who were trained as ambassadors. And then last school year, 2021, we increased that to 321 students who are trained. So we have over 300 students on our campuses. Students love this program. This year, we're continuing to do this in all high schools, and again, collaboration with Be Free Lake, and we're hoping to bring a similar model to the middle schools. It's so popular that we'd really love to bring that down. Restorative practices, I just wanted to highlight some overlap between our departments and programs here. The mental health liaisons certainly have been trained in how to conduct and support restorative practices, and I have some information here about activities that they've conducted. So we see, the trend to go up in middle and high, in elementary and high, and then a little bit of a dip in middle school there. So again, I really do think that we have the same kind of issues in middle school. Group counseling. If we move to thinking about how to support kids who are at risk or starting to exhibit challenges, one way we do that is through group counseling. It's a way to deliver direct services to a high number of students at one time. The numbers decreased this year at all levels, but really, honestly, we think it has to do primarily with the restrictions that were implemented in response to COVID-19. So you couldn't have a group of kids without significant social distance sitting together and engaging in psychoeducational, talk, just because of COVID. So I do believe that's what caused that to be so low.
Can I go back one slide?
Sure.
Where it said restorative practices, and you said there was a dip. Was I reading the wrong slide?
In middle school?
You said middle school had a dip? Because they have a increase, right? What do you mean by dip?
So in middle school, the previous year, they conducted about 561 activities, and then last year they conducted 363.
Oh, that's what you mean by do. Okay,
Yeah, I'm sorry.
I see. But I guess the middle school being higher, I mean, isn't that just partly the age? I mean, it's so miserable. It's a hard age. So that's what I just was thinking. That seemed normal.
Well, they certainly were successful the previous year in doing it. So again, it might have to do with the number of kids on campus.
Yeah, yeah, okay. Thank you, I just didn't.
I thought similarly, like, oh my gosh, middle school is where we need the services a lot. So I hear what you're saying, Dr. Bruce.
There's group counseling.
How do they come up with the topics for support at the individual schools for like the group counseling or the restorative practices?
So lots of our mental health liaisons do needs assessments with the teachers or with the administrative staff to look at the needs. It's based on whatever the students need. So individual counseling, it was a little easier last year to kind of keep individual counseling going because you don't have the multiple people issues. Elementary continued to increase. Now remember that all counseling, both group and individual that I'm referring to here, are done by our school mental health professionals. And they're designed to be supportive, short-term, positive, and skill-based, and always with parent permission. Students needing a higher level or more complex level of support were referred for therapeutic services, and you'll see those numbers in just a moment.
Do you have any data like that would overlap with, like, similar to what Ms. Pearson presented with, like, how many counseling sessions? Was it repeated throughout the year? Was it like a shorter term to show that your longevity of services might be then transferring to, I don't know, less out-of-school suspension or in-school suspension opportunities? Are you guys looking across that way?
Let me go through the rest.
Okay.
There might be slides that address
Okay.
that, and then you can let me know.
Thank you.
Okay, so collaboration is something that we highly value in our program, and this is just a sweet picture of our collaborative team at Triangle. Our partnership with Livestream is solid. These are the areas that we collaborate with them, and I'm going to show you a little bit of data from each one of these areas. Now remember, Livestream kind of takes over for us when our educative strategies aren't enough. When students need more, then Livestream steps in. Since the beginning of our program, we've had a clinical coordinator. She's a Livestream employee, but almost 100% of her job description is to support and provide services to Lake County schools. She's an amazing bridge between Livestream and our mental health liaisons and mental health specialists. She's on call for us all the time. She provides professional development for our mental health liaisons, teachers, parents. She runs groups at some schools, and she's a first contact for our mental health liaisons when there is a high-risk suicide, a screener. Then we have to go on and do more evaluation, and she's kind of the first up for that. So when she's called in, she follows up with additional de-escalation attempts and a more comprehensive evaluation of the risk. So here's the data from her for the last 2 years. In 1920, she did 74 of these evaluations for us, individual student evaluations. And then last year, she did 83. Very consistent. Children's Clinical On-Site Services is the way that Livestream delivers therapeutic services for our students. And most of these services happen at schools. So you can see in the 1920 school year, there were 867 students who were served by Livestream in this capacity. And then this last year, there were 1,057. So they certainly increased the number of students that they worked with. And then the graphic on the right-hand side really just shows the increase in sessions each month. So Livestream certainly servicing a lot of students for us. Mobile response team is an immediate action clinical evaluation scene that is 24/7. And so a lot of our families can access MRT from home after school hours. The mobile response team is one of the options that our schools have when a student is experiencing those high-risk suicidal ideations. So I just have some data here. The number of on-campus evaluations completed by the mobile response team in 1920 was 94, and then last year was 100. So another very supportive team. Baker Act. I want to talk with you about Baker Act for just a moment. Decreasing the number of Baker Acts that our students must endure has always been one of our biggest goals. We do not want to have to re-traumatize students by having to endure that. But one thing we've learned over the years is the data is tricky. It's very difficult to gather consistently, and it has to do with, for example, law enforcement keeps track of Baker Act data, but they don't keep just schools. They keep from community as well, and then not to mention we have the Sheriff's Department and 8 other municipalities. So it's kind of hard to get all their data. Livestream keeps track at the hospital, but those are also community as well as school Baker Act. So one of our specialists receives daily census reports from the hospital, but again, it's not just school, it's community Baker Acts as well. So the number that we're going with this year is based on what our mental health liaisons reported at the schools, and so the number was 42. It was up a little bit from last year. I think last year's number was 36. But still, I think 42 across the year is not a bad number, and all of those students receive services.
Excuse me, do you know if these 42 have multiple, if they have students that were Baker Acted more than once? Or was it just 42 individuals?
I would have to double check with my person who keeps this data.
Okay. I was just curious.
Mm-hmm. I'm sure there are people behind me taking notes like crazy, so I will get that information and share it with you. I'm interested to know. I don't remember which way that goes. So the CAT team, Community Action Team, is also a model that delivers wraparound services for families with high needs. They might have more than just mental health needs going on in their family, and so we have a community action team here in Lake County that works for Livestream, and in the 1920 school year, they took care of 70 students, and then this last year, 57. I do know Dr. Crandall, the doctor who runs those teams, also was talking about the effect of COVID over this last year. It was very hard to get into parents' homes and do multiple sessions with them because of COVID. We also do have collaboration with 13 other community agencies besides Livestream. So throughout the district, we have individual agencies who we have contracts with to allow them to come onto our campuses and see our kids. 673 was the number from last year, down to 304 this year. So I do think, again, COVID was probably a major impact on those agencies. I wanted to keep this slide in the presentation because this continuum of school mental health services work group, as you can see from the members there, is extremely dynamic and powerful, and we come together every month and we problem solve about our entire continuum, not just school, but services that kids and families need above and beyond school. So this is a work group that you are more than welcome to sit in on and kind of hear what we do. Dr. Burns, didn't you sit in with us one time?
It was excellent.
And so we do that each month as part of our collaboration. So this slide, I thought you might be interested in the number of mental health liaisons who collaborate with school-based personnel and then district personnel. So as you can see, and this is an obvious one, 100% of our mental health liaisons are collaborating with their administrators. That's very positive. 97% are working with their school counselors. Then we have how much they collaborate with past teachers, school nurses, and then at the bottom, school social workers and psychologists. So their collaboration across departments is very high. And then while they're collaborating, what are they doing? As you can see here, 83% are working in MTSS problem-solving meetings, 92% participate with ESC, Section 504, threat behavior assessments that Mr. Mabry mentioned earlier. 83% of our folks are very active in those meetings as well. Okay, we keep on going. This is another school team that has some amazing collaboration, and they have built a mental health referral process at their school that they're very proud of. So let me move to crisis intervention. This is the most critical work that we do, and we really do believe that we're saving lives. Our district uses the Columbia Suicide Severity Rating Scale in order to assess suicide ideation risk. This is a screening instrument. 2 professionals are trained at every school. This graphic shows the number of risk assessments completed by school personnel last year, the last 2 years. So you can see from 2019 to 2020, 21, the number of assessments completed went down each year, which is excellent news. We're not having to do as many risk assessments. This graphic is important. This is the percentage of students at each risk level as a result of our screener. As you can see, at the elementary school level, this is last year, 13% of those screeners came out to be high risk. At the middle school, 33% came out to be high risk, and at the high school, 55% came out to be high risk. So for us, when we looked at that data, we thought, wowzer, high school really had a big jump. So we pulled last year's data and wanted to compare it. And the interesting thing is, it's the same number of students, the percentage is just different. So at elementary last year, the percentage was 19% versus 13 this year, but it was 57 students, whereas this year it was 36 students. The previous year at middle school, it was 35%, 33, very similar between last year and this year. But last year it was 62 students, and this year it was 53 students. So it has to do with the number of assessments that are done. But then at the high school, last year it was 28% were high risk. This year it's 55%, but really the number's not all that different. Last year it was 46 and this year it was 59. So not as big of a jump as you would think from looking at the 55%.
But it's still 55 high school kids?
57. 59. That received a high risk on a screening. Screening. This is the one that the mental health folks do. Yep. And then what happens when there is any high risk, we go to the next level, which is that evaluation that is more comprehensive by either our clinical coordinator or the mobile response team. And this is the data that shows who did that next level evaluation for us. So the first person that they call is the student's counselor. If the student already has a CCOS counselor and they already have that relationship, you really want them to do the evaluation. So there were some students who could take advantage of that path. If not, we call the clinical coordinator. And as you can see, the number of evaluations that she did went up from the previous year to last year. And then we have mobile response team. So we intervened with a lot of students, but what we know happens, Mr. Mathias, is a screening measure catches way more than are actually that serious, and then it kind of funnels down. Okay. After any high-risk screening, even if they don't end up going for a Baker Act, our mental health liaisons schedule a return-to-school meeting. So they come back to the table with parents, teachers, and make sure all the resources are in place for that student, and any referrals that are needed for the school or the family, or for the family and the child, have been done. So we always have return-to-school meetings on all those students. Another realm of crisis intervention for us is helping students' families after larger crisis events, like the death of a student or a staff member. In last year, 2021, there were 6 crisis events in our district that were that our district crisis team was involved in and went to the school to support. We have 75 professionals trained in Prepare, this nationally standardized framework. I've shared with you in the past that this training is amazing, but it's very expensive. It is considered the gold standard for how we go out and support schools after a crisis. So I'm very pleased that our district is now using it, and we're training more and more people to engage with us in this Prepare method. As I move to parent and community awareness and education, I do want to pause there for a few seconds because I want you to fully appreciate this amazing artwork that was done by a student at Lake Minneola High School. Amazing, right? Talent, talent, talent. There are a variety of ways that we tackle engaging our parents and the community. The district specialists put out the Mental Health Matters newsletter 2 or 3 times a year. You may remember seeing that last year, which is shared and then posted on social media. We have a Facebook presence that we try to increase. We have a very extensive mental health portal that is linked to the district website, and it has resources and contacts for parents, teachers. If you haven't had a chance to stop by there, you might want to take a look. It's very extensive and has lots of resources for parents. This is an example of a Google Classroom. Just thought you might enjoy seeing what that looks like for one of our mental health liaisons, so she could make sure she stays in touch with those students who were learning at home. And then all of our mental health liaisons are responsible for having their own link on the website, so parents can go to the schools and always be able to find the mental health liaison. We had a very successful Mental Health Awareness Month last year. That was May. These are just a few examples. There are more in the annual report, but just thought you might like to see the happy faces of kids. They really did enjoy engaging in those activities, and many of them were student-led. Professional development. The one I wanted to focus on for professional development is, of course, the Youth Mental Health First Aid, because I just wanted to make sure everybody has an update in terms of where we are. This is the mandated training. And the goal for the Youth Mental Health First Aid course is to help adults identify the difference between kind of typical adolescent behavior and behavior that might indicate that there's a challenge or a need for further support. In 1920, we trained about 28% of our staff. And what is in statute is that every person in Lake County schools has to have the training. So we got about 28% that first year. Last year, we got another 25% or so. We were up to 56.6. And then this year, we're going for 75%. So we're hoping to train another 25% this year. In 1920, we had 6 mental health professionals who were nationally trained as trainers. And then in 2021, we got that up to 11 trainers. And this year, I have 6 more people on deck to become national trainers. So I do think we will easily be able to meet the goal that we have set here.
By when do we have to have 100% by statute?
Well, we have, from the application this year, they asked us to describe our training plan for the next 3 to 5 years.
Okay.
So I think we've been given some grace, and we have 3 to 5 years. Okay. Now, what we are asked to do in the meantime, because we know we couldn't train everybody that first year, so what the state asks us to do is provide kind of a basic mental health awareness. Cognito is this program. It's 2-hour virtual interactive role-playing with the simulation. It's a pretty cool program, but it's much shorter than the course, and we can provide this to all teachers, and we did that first year. So when people come new to our district, they always get this Cognito training until they can get into the 6-hour course. So we really do have a way of making sure that all folks who touch students' lives have at least this basic awareness. And by the way, you all can come and sit in on a mental health training anytime you'd like. You might enjoy it. Program development. I believe if you asked the mental health liaisons, they would probably say that some of the hardest work that they do doesn't involve direct student services. It's program development. The only way our district-wide program can exist and be successful is through the individual creation and monitoring of every school-based plan. And our mental health liaisons do that on top of all the other amazing direct services things that they do. So from this is just an example of the expectations for their school-based plan. They have to tell us how they're going to collect data. They've got to do needs assessment. They're expected to keep a calendar. They have to have a system for referrals, and they have to identify through needs assessment any professional development activities that are needed on their campus. And that's not even to mention Medicaid billing, lunch duty, bus duty, anything else that administrators ask them to do because they're an integral part of the school team. So looking forward, as I shared with you about a month ago, our state application includes these two goals. One has to do with the fidelity of our Tier 1 programs, and the other has to do with the increase of direct services to students. One thing that we are working and talking a lot about, Ms. Luke may address at least part of your question, is we are gathering and have been gathering a lot of information that has to do with process data and perception data. We are starting now to grow into the field where we are looking at true outcome data, and that is like pre-post assessments. So for example, when a mental health liaison conducts a 6-week group about self-regulation, we want to begin looking at whether or not participation in that group made a difference in the student's functioning. So the problem, there are lots of ways to gather this data, but it's very labor intensive and it's difficult to do it correctly. It's a little easier to say, hey, we ran 500 groups this year, but to know whether or not those students in those 500 groups actually individually benefited is very difficult data to gather, but we are moving that way this year. It's our next step. We know we're delivering great services and touching lots of kids, but now we really want to dig in a little and look at the actual outcome data. I am very excited to tell you that we're working with law enforcement and DCF to bring the Handle with Care program to Lake County schools. The superintendent asked us about a year ago to look into this free program that's being used in other districts, and districts love it. And essentially what it is it's a notification system for traumatic events that happen to kids overnight. So if there's an event that happens to a family overnight, law enforcement or DCF will be notifying a contact here at the school system, and there's one in law enforcement, that juvenile officer that Mr. Mabry spoke about. She's going to be helping us. And then there's a critical alert that will come up in Skyward. Now this alert will just say something like, it will be like an H or a heart. It just means handle with care, be connected to the student with no information. We aren't sharing any information about what's happened to the student, but what we want teachers to know is that something happened. And so if the student is sleeping in class, know that there's a reason, and let's have a little bit of grace and compassion. So we're working on getting those in place right now, that program. Again, based on feedback from stakeholders, we are going to be doing our 5 hours of student instruction a little differently this year, hoping to see good feedback from that. And then I talked about peer programs at the middle school. Okay, so I'm going to take a breath and take a pivot here to talk about nurses. And I promise you that school nursing services are much more succinctly represented here in this presentation. And then we can circle back around and ask any of your questions. So some people might wonder, why do we even need nurses in our schools? And this graphic actually shows 7 compelling reasons why we have nurses in our schools. Over 35,000 students in Florida have life-threatening allergies. Almost 200,000 of our students have asthma, and almost 8,000 students have diabetes. That's just 3 stats off this slide that let us know that we actually really do need school nurses in our schools. This is the national framework that nurses practice under. And as you can see there are overlapping expertise in care coordination, leadership, community health, and then their standards of practice overlay everything. This is generally our nursing plan in Lake County Schools. So we had 26 LPNs. Each of those LPNs is in a school-based clinic, and they deliver direct services to the students and deal with student emergencies. We also have 13 RNs. They each have their own clinic, and they also provide oversight to 2 or 3 LPNs that are geographically close to their school. So we have RNs supervising LPNs, and then we have 3 district health educators at the district level that do oversight and support all the regions. They provide all the trainings to the nurses. They collaborate with the health coordinators on every campus. They work on policies and procedures, and then, of course, they cover clinics if we need them to. And then we have UAPs, unlicensed assistive personnel. These are people that we're allowed to have per the state law, who nurses train to go into our clinics to help when nurses aren't available. We recommend that they have 4 or 5 in each school, so that, and especially that's been very helpful now with nurses being out quarantined, that those UAPs can sometimes step into the clinic and help when they're trained for all individual needs as well for students.
Quarantines, how does that work? Like, they must all be on quarantine.
They're not all on quarantine, so
Like, how do they not be exposed?
Okay, so we purchased for them a KN95 masks, which are considered medical grade masks. And they are required to social distance as much as they can. And a lot of their contact is less than 15 minutes. So say, for example, they're in an isolation room. They have on their K95, and they should all be social distance. So the nurse is there providing supervision and oversight, but not necessarily coming into contact with kids.
I imagine many are probably vaccinated, are they not?
Many are. Many are.
A lot of them also give them a bigger space. I know last year my mom had a classroom, like a classroom this big. And then there's an opportunity for a student to be isolated away from her where she's over here on the other side of the room and can still provide the support while they're waiting to get a hold of the parent. And it was nice that they were able to be in the same space so she could see the child. And then while they were waiting, they didn't have to send them somewhere else. But I know that different schools are handling it differently.
Yes. Mm-hmm. It does happen, though. I have lots of clinics right now that the nurses quarantine or they're home with sick children or sick family members. It's very difficult right now. Just wanted to show you the number of clinic visits. In case you ever thought our nurses weren't busy, the total there all the way to the right in 2019-20 was almost 200,000, 119,000 clinic visits. And then the last year, it was 110, down a little bit, again, having to do with COVID, I'm quite sure. And then one other thing that was a significant decrease I was a little bit surprised about was the number of mental health referrals coming from nurses. In the 1920 school year, they submitted almost 3,000 mental health referrals, which is fantastic. And then this last year, 2021, it was down to 615. But again, I think they were consumed this previous year with COVID, all things COVID. And so to demonstrate that. Yes.
Sorry, back on that one slide, and further really complicating things here, if you just do some quick math, I haven't pulled out the calculator, but elementary and high school, you got about a third of them with the referral, but then middle, like 1/9. So
agree.
There's the
trend, right?
There's the middle school trend that we've just constantly been talking about through this presentation, and
absolutely.
There's another indicator of it.
And we recognize that on putting extra supports and strategies in place for middle schools that we hope will help provide them with support. So just so that you would know kind of a couple of the ways they were involved with COVID, they assisted at 14 vaccination clinics that we held at our school sites. And then in October of 2020, the nurses began testing in their clinics, actually doing COVID testing. The elementary tested 289 kids, and the middle and high schools tested 355. So they did a fair amount of COVID testing last year, and they're doing that again this year. Okay. Thank you so much for indulging me, allowing me to present you with all of that material. It's a lot of words, right? I've been talking a while.
Very good work.
So I'd be happy to entertain any questions that you have.
I have 2 quick ones.
Yes, ma'am.
The clinical coordinator, who pays her salary?
So that money comes out of the state mental allocation funds.
Okay, and she's housed at Lifestream?
She is housed at Lifestream. We pay the majority of her salary, but she is an amazing bridge. Like, we talk with her daily almost. Was that your other question?
Yes, ma'am.
Okay.
My only other thought that I saw in here, and it goes back into the slide, I'm not going to go back through the presentation, it was lengthy, but the slide where it talked about the nurses collaborating, or the mental health liaisons and who they collaborated with, and I know nurses was on there, it was one of the lower percentages. It was still a good number that said they collaborated with them, but my wondering is, and this is just in conversations I've had with 2 nurses, so that's not a significant number of nurses, but, what I hear is there's a trend in like a certain class period where the same students are coming to the clinic. And we know that as teachers, that they're just trying to get out of class or there's something going on otherwise. But where a nurse might not have an educational background, it's like, have you talked to the teacher? Have you done that? So are there opportunities for that? So maybe that's not necessarily a mental health referral. I wouldn't refer a student to the mental health liaison because they're trying to miss algebra, right? But is there an opportunity for your nurses then to collaborate with your administrative team or to have a conversation with somebody about why does Mr. Dodd keep leaving 5th period and coming to my clinic to try to skip class or to get out of class? Mm-hmm. Because there was often friction in these 2 experiences from the people that I contact where the teacher would get upset with the nurse for having them in the clinic, but the nurse would say, I'm telling them to go back to, so it's like this. And I just don't know where that happens because that to me would be a perfect opportunity for them. Okay, let's have a conversation about what's happening here and to help the student in all of these things that we've heard earlier.
Yes, agreed. And we encourage collaboration with nurses just like we do with the other groups. And we hope that they are collaborating. We're going to continue to encourage that. I do hope that they are having conversations like that with teachers. But I think that we can provide more support there. Yeah.
That's all.
Okay, thank you very much. We're going to take a 3-minute break.
Okay.
We're all back? Sort of. Okay, Dr. Felder.
Well, it is now good afternoon, I think.
Yes.
So thank you for the opportunity, Chairman Mathias and Superintendent Hornsby and board members. I first want to just say how proud I am of the others who presented before me as we consider the last year and how difficult it is to compile data and to look at our programs across our whole district. It certainly is a testament to how hard people are working. And so I just want to say that I'm very thankful, and I want to thank them for the job well done so far today. And also to let you know that while I am the voice of the last part of our presentation, which is student achievement, I certainly did not compile all the data alone. Accountability and assessment, CIA, academic services, my whole team has definitely chipped in to be able to bring you some data around student achievement. So while I want to give kudos to all the people, I also would be remiss in not starting with this idea that we should just be really, really thankful to all of our leaders, to our community, to our students, to our parents, to all of you, because what the information, I'll just lead with the headline, is we did pretty good amidst a really, really hard year. It's the hardest year I think I've ever witnessed in my educational career, maybe in my lifetime, in terms of trying to educate students and keep kids safe all at the same time and healthy. So we did continue to learn at high levels, and so that's kind of what I want to start with. So my presentation mostly deals with last year and talking about last year, and then a little bit about moving forward. So if you'll go on to the next slide, please. As you remember, we had opportunities to learn in various ways. And so just a reminder that we had 3 different modes of learning for the most part. It was in-learning, Lake Live, and Lake Virtual. And per the governor's order, we were allowed to have those innovative learning options. And so we did engage in all 3. And to move to the next slide, you saw this slide last year. Just a reminder that we started out with about 60-some-odd% in traditional face-to-face, and then as the year went on and more parents felt safe, we were at about 75%, 74% in the face-to-face mode of learning. So, and that continued to grow throughout the year as well. Next slide. So I also just wanted to bring this back to you, in a year where districts were trying to locate all of their students, we started the year with 3,100 students that we could not locate. Again, our team rallied together, put together a system in place, and we found all but 172. So again, a really strong effort to make sure that we knew where all kids were and to make sure they were all learning in some way. Next slide. So here's where I want to linger just for a minute. I've also given you an extra handout. I think it's important to look at this. This is our attendance by district and region. So when you look and compare the 19-20 school year, we had 11% total students that were absent 10% or more. So you think 180 days, 18 days would be 10%. It's almost a month's worth of learning. Last year, almost a quarter of our students had missed that much time. And this does not include quarantines.
Why? Why?
It is because quarantine students are marked as present. So they're marked with the B. Why does it not include quarantines?
Yeah, because it seems to me that would be helpful information for the actual student and understanding what's going on. Unless you have some other column for those days out, because they're not educational. I mean, when they're on quarantine, they're not working. They're not. Mine aren't.
So I think,
and I try.
I think my point in this, showing you this, is that we had a lot of students that were not at school, and you would have to add the quarantines on top of it. You know what I mean? So kids who are in quarantine are counted present. When we pulled absentee data, which is the single sheet that you have, you can see that sometimes kids were not there because somebody else was sick in their family, or they were fearful that there was a case at their school, so they didn't come the next few days, or they didn't. We did not encourage. We definitely wanted people who did not feel well to stay home, but my point is that it was a challenge. It's challenging. They always say you can only teach them if they're there, and so although we used various virtual methods to try to reach kids through Google Classroom, I think this data is significant because it does show that we had a challenge with kids, and it's just because it was COVID. I'm not saying it's the reason, but certainly we had a challenge.
But besides this chart, to Dr. Burns's point, that when you start looking at student achievement, if we're showing the child as present, but they're quarantined, don't you get you're not going to get the right, they're not there. And you know what I mean?
So these numbers would only go up.
That's my point.
Yeah.
Right.
But that would be,
But wouldn't that explain what's going on?
that would explain the loss of learning gains.
Yeah.
Yeah, well, I think this explains it well enough. I mean,
You can just.
I don't know how far you want to dig the hole, but we got started right here.
I think our jaw already drops when we see this number. We just want to, I guess we want the visual of how far did the jaw drop,
So
you know?
I did not pull the B data, but I certainly, we can definitely pull the quarantine data. I will say, we could maybe pull but I'd have to ask Dwayne, but we could probably pull it for you.
But if we have, in 3 weeks, we have 2,625 students in a week that are quarantined, then that should tell us they're not learning, right? I mean, I'm not saying that you should justify anything, but at least it would understand what we're losing when we don't have the
Opportunity cost.
There is a cost to that.
Yeah.
That's all.
So I did provide you a sheet that talks about students who are that early warning system, the schools that are doing, that have, had some that we marked as sort of those concerned schools. And so you can see compared to 19, if you look at the third blue column and then the fifth blue column, it's just kind of a good visual of, it was a challenging year for kids to be in school, whether that was on Live or whether that was in traditional settings. So just a little bit of information. Next slide. So knowing that we could face some learning loss, we definitely beefed up our summer opportunities. You saw some examples of this, but we certainly expanded our VPK programs, our kindergarten readiness, brought in some students that maybe didn't start last year in apprehension of the COVID situation, and so brought them in early this year, started them a month earlier. Our third grade reading camp certainly was taking place, ELL, extended year for students. We definitely beefed up our summer opportunities. Academic services, that team did a great job of providing kind of a more comprehensive look at what summer learning could look like. Still continued to have ELC. We did some course credit recovery, and then also supported some of our seniors to help make sure they could graduate. So we probably had over 2,000 kids at least take advantage of our summer opportunities. So I think that was a really great opportunity for us to sort of continue learning even past the last day of school. Next slide. So when you look at our achievement by comparison year, you sort of see a look from this most current years on the top, and then all the way back to 2017. And I think what you see is, but through achievement, I mean, we did pretty well. We held our own. We still maintained learning while not knowing that we don't have some challenges and some work to do to make up for it. But we certainly stayed kind of in the ballpark, and I think that we should be proud of that, considering what we were facing last year. Next slide. So when it comes to learning gains, this is an area that we know that we saw more of a decline in. I can talk about several reasons, maybe some things that I think that it had to do with. A lot of it had to do with the fact that we were kept kids in cohorts because we needed to. Everything that we did because it was we should have done it for students. But it does sort of speak to the idea that we didn't have the opportunity for kids to get extra support in many places because they couldn't move or walk to intervention. And so you'll see that that's one of our looking forward pieces, that we know that we've got to get kids the help that they need, kid by kid, skill by skill, making sure that they're supported with intervention and acceleration opportunities. And that goes as well for kids who are high achieving. They are also responsible for making that learning gain. And so when you look at even our top 2 ELA and math learning gains, you see that you see a kind of a decline, especially in math, where we may not have accelerated where we could have as well. So it's kind of a push for us in the upcoming year. Next slide. So one of the things, I don't know if you remember, but the state offered us to give an assessment, a progress monitoring piece called the APM. And it was a free opportunity for us. We tested it out. Schools gave it at least once, some gave it twice. And we actually did a study on it. St. Lucie did a study on it, and they found some pretty good results. And so we wanted to do our own based on our own scores. And I have to tell you, it has a pretty high reliability, a pretty good correlation to our students' FSA scores. And so we just wanted to let you know that we are always looking at those progress monitoring systems and making sure that they are aligned.
Can you help me understand, maybe I need a little statistical math lesson on this one. When we're talking about the strength here, and I'm just going to use the very first example here of a third grade ELA, where the strength is 0.72. Are we saying that 72% of the time the scores, if you pass the APM, you pass the FSA, or what goes into that?
I think that.
How was that computed?
I think it looks at, so like that's would be APM 1, so that's the first time they gave it. So that's important to note. So they gave it the first time like in October, up till December to give it, and then we gave it again kind of in that January, February mark. I think what it means is that if you scored a 2 on that test or a 3 on that test, then the correlation that the score was the same on the FSA. Does that make sense? So it's not necessarily passing, not 3 and up.
So your score would have aligned 72% of the time?
Yeah.
Or
they predicted if I scored a 1 on APM 2, you'd hope that the prediction was better the second time, right? Because we took it later in the year, hopefully use the first one's results. So that's why you see some it going up. But basically the correlation is if that test said I got a 2, kids did get a 2.
Okay.
78% of that.
All right.
Does that make sense?
Yes. Thank you.
So we do plan to continue using that a little bit this upcoming year. You'll see that in our assessment calendar when it comes before you soon.
Will we be dropping any of the other assessments, like the Lake, like any of the other local ones, if we're adding the APM?
So they will be optional. So for anything that this goes into, the other tests would be optional.
Okay, so they don't have to necessarily double.
Next slide. So at the end of the day, here's our district grade comparison, and we remained a B. And so this is what I think kind of the news for us, and we all know that this is already in place, but I just want to bring it up to you again. I do think we have a lot to be proud of in a year that was very, very difficult, that we saw a small decline of 3%, but that is not significant when it comes to statistics in terms of, where we're headed. And so I'm very proud of the fact that we continue to learn and do what we could to make sure that kids had a high level of learning throughout the year. So I'm going to break down some of that a little bit for you on the different components. You've already seen the ELA achievement and the learning gains, but let's go into some other of the components. So if you look at the next slide. There are some district highlights. As you know, we are a B. Beverly Shores, let's all take a minute and congratulate them. Yay, right? So they are out of school improvement status and they are now a C. Most of that came from their math learning gains and their 5th grade science. So we knew in elementary it was very difficult to continue to, 5th grade school grade was elementary school grade was very reliant upon 5th grade. And so, because that's where all the gains were, because we did not test in the year 1920. And so, if you look at some of our schools, certainly some of that came into play. And Beverly Shores is now a C, so we are very, very excited for them. Although we still support them, still keeping some supports in place, certainly, to make sure that they maintain that status and continue to improve. Humanville Elementary went from a B to an A, something else to celebrate, one of our only schools that continued to raise their school grade. I will tell you that when we looked at the amount of students that were doing face-to-face instruction, that is one of our highest schools that began with most of the kids in school, ended with most of the kids in school, and had very few quarantine situations and COVID situations. So sort of, you can kind of look at, I'm not saying that they did everything they should be doing, they continued to work, but certainly it was a situation where you could kind of see some correlation when you start looking at some of that. And then Cypress Ridge Elementary remains a school of excellence, so they still have that opportunity. And just a reminder, they have an A or a B in each of the last 3 years and had to rank at the 80th percentile or higher in their school type for at least 2 of the last 3 years. So that's something that's to be proud of as well. I'll remind you that we have made huge strides, next slide, in graduation. So thinking about, I know we brought these numbers to you already. If you'll click the next slide, please. Looking at our increase in graduation, this is certainly one of our most significant places to be proud of. Seeing we went from 77.8 in 2017 to 91.2 in 2020, and I will tell you that our predictions for graduation as college and career readiness and the director, Francis Ellis, continues to work on those, and our graduation rate is looking good for the upcoming year as well. So I'm not going to give out any numbers yet because I'm not quite sure, but I do think it's looking pretty good. Pretty happy to see that. And then just know that everybody else had the same chance we did to improve their graduation rate. And if you'll click on the next slide, just a reminder that it's the first time that you've seen us in the top third of the state with an overall district score. So I'm pretty proud. I'm always trying to get to the top third. I really want in the top 10, but the top third, I'll start there. And this is one place where we have an indicator and we achieved it. So I'm very, very proud of this and want this to continue. Next slide. The other piece is our industry certifications. I thought you might want to see what those numbers look like. This is a 4-year look at our industry certifications. We already have done some figuring because we do have those results back. You'll notice that, just to note, you can only use 2020 data for school grade. So when you look at the district grade, the 2020 column, the third column is where you would look to see what data was inputted for that district grade. And the 2021 would be the data that would input for this upcoming district grade. So some of the things that you'll notice is there is sort of a decline. And I just want to make sure that you realize that in 2020 we lost a testing opportunity because we closed early. So that had some changes. And then in 2021, interestingly enough, some of the things that happened were reduced student enrollment in the courses. So kids in Lake Live didn't often take CTE courses or virtual. It wasn't really one of the courses that they took as often. And then block scheduling also it did sort of hinder that a little bit. Some of the people didn't test. They didn't use all 3 opportunities. So for instance, if I had the class first semester, I may have only tested first semester versus continuing to test even in second semester while I was not still in the course. So there were some factors that came into play, but still working pretty hard on our industry certifications. Next slide. We also want to look at our advanced placement, just to take a look at that. As you know, some of the data, it's hard to look at this data. I want you to know that the data sometimes, we have numbers for you, but we do have to put it into context. In 1920, it's not incredibly accurate. The kids took a 45-minute test from home, so it was a different testing year. In 2021, they had different options. Some of the kids could test at home. Some of the kids took it at school, so it's a little bit hard to realize the validity of it. But it is here, and when you look at it, AP courses are more of an open enrollment, meaning that all students can have the opportunity to enroll in the course. We gave over 4,500 exams in 2021, and so I just want to sort of bring that data in front of you to sort of look at. I will tell you that we know that advanced placement is an area that we continue to support. We have new materials from College Board that allow us to help teachers. We are looking at the usage of those pretty carefully, wondering how many people are taking advantage of those, so sort of studying that. And then also this summer we launched, College and Career Readiness launched a great summer opportunity for freshmen to and their parents to come in and kind of see what is it like to take an AP course, and to have some professional learning around being a student in an AP class. So continuing to support that as well. Next slide. So just to understand sort of what our diploma situation looks like, I thought it might be interesting for you to know sort of how kids earn a capstone diploma, which is the advanced diploma from advanced placement. And so you can see there what the criteria is. In 1920, we had 11 diplomas, and this year we had 35. So certainly we are seeing more students come out with those diplomas. So that data is looking good. Just so you know, in 1920, the data was for East Ridge High and Lake Minneola only, and then 2021, it also includes South Lake, Tavares, and Eustis. So then I want to look at dual enrollment, because all of these pieces play a part in our acceleration. So the next slide, please. So you'll see our dual enrollment and our 3-year comparison for those numbers. You see fall and spring. You'll notice that the summer totals for this term say 0. It's because we don't have the data back yet, so we don't have that ready as of now. But so we definitely had kids take summer courses. I don't want you to think that we did not have students in dual enrollment over the summer, because we certainly did. You can kind of see that we've seen some decent pieces of that. Staying pretty steady in terms of fall and spring. We certainly have lots of students take advantage of that. And then the next slide will show you what we graduated this year. So if you look at the next slide, you'll see that an AA diploma takes 60 credit hours. And in 18-19, we had 72, and you'll notice it just increases in 1920 to 133, and in 2021, we had 104 so far. So, and 83 of those were the HSCA this past year, so I thought you might want to know how many students graduated from HSCA this past year, and that was 83. And then if you look at our ACE, which is kind of our newest addition to the opportunity for kids to have college opportunities in high school. If you'll go to the next slide, please. You'll see here there's a 2-year comparison. When we look at 1920, you can see that we have data for Leesburg High School, and then we also have data for the global rates. So when you look at the 1920 year, you can see that. Of course, the 2021, we don't have global rates yet. They're not due out until September. And so we had, this is more of a cohort approach where students have an application. There is some open enrollment courses that students can take, but for the most part, this is a cohort of students that apply and then become an ACE student. And so we gave about 150 exams in 1920 at Leesburg High, and then we've given 550 exams this year at Umatilla High and at Leesburg High.
These are the passing percentages of those exams?
These are the, yes. So just to note what's coming up as our feeder school, middle schools are getting pre-ACE this year. We started with Carver, Oak Park, and Umatilla. So that kind of lets it, the feeder patterns were growing in that direction. So if you look at the next slide, you'll see our ACE diplomas. We did have our first group of students graduate from Leesburg High. We had 9 diplomas. It kind of gives you an idea of what it requires to have a diploma. I thought that might be helpful to see all 3 programs in one place.
I was hoping to have I've got some thoughts that I wanted to share on a more in-depth AP and ACE discussion. I don't know if you want to do that now or since you're so close to the end of the presentation, let you get to the end, or what you'd prefer from a flow standpoint.
I'll do whatever you prefer.
Okay. Well, so I guess I know that we, for a number of years, have been looking at AP data, and I know that our numbers are lower considerably because of the open enrollment component that a lot of other districts don't necessarily put in place. So I know it's challenging to make some of those comparisons. But now, as I'm looking at the percentage of students passing an AP exam in our district versus the percentage of students passing an ACE exam, I just have to wonder if AP is really the route for us to continue pushing or looking, or I think there's a bit of a disservice to kids when they're getting to the end of these courses and not passing the exams, and then they're not getting the college credit for the course.
And we're being somewhat penalized. Because I thought what we were doing this year was that we had like pre-AP, so that we didn't bring kids in with an expectation that they probably would fail, but we had this another level below that. Didn't we do that at like Mineola, for example?
And at East Ridge.
At East Ridge, which makes a lot more sense to me.
I think the challenge is that some of these courses don't have a pre-AP sequence for them. For instance, so a common one for 9th graders to take is world history. Human geography. And there's not a pre-AP human geography that goes into that. So essentially you've got 14-year-olds taking their college course, and you can see from the district side, I think we had, was it like 26% had passed? Only one school had passed more than half their students, and it was like virtual. So the kids who were teaching themselves are the ones who had the best shot at passing the exam. I just think that's a bit of a disservice when you welcome to 9th grade, here's your first AP course that only maybe 1 out of every 4 of you is going to pass. Oh, and now let's have you keep going on this AP route. See, I'm just having more and more discussions with parents calling and saying, hey, so now I'm trying to decide for my kid, what's the best route? Should we continue in AP? Should we go dual enrollment? And I say, well, gosh, every kid's different, but the challenge is when you've taken a few AP courses and you haven't passed any of them, what's your incentive to keep going on the AP capstone route? When you could do the dual enrollment, you pass the course, you get the guaranteed college credit. But then I also look at this ACE thing going, wow, our students are passing the exams. Why is that not everywhere? Why are we not, chasing that rabbit versus the AP?
It's an ACE.
Yeah,
Okay.
chasing ACE or IB because there's
You
also
heard the question.
because there's also the pre-ACE or the pre-IB that
Right.
builds before you actually take the test in the subject.
I thought you might ask me that.
Okay, good. You must know.
So we believe that they can all exist together, but I'm not going to argue one against the other. But I did have an opportunity to do some pricing, and so to expand the ACE program. So I do have some of those numbers for you if you'd like me to send them to you. But it's a little costly. It's not that we can't put it's not that we can't put ACE. It's one of those things we can do anything you want. Just can't do everything you want. But certainly we can put ACE in all high schools. It's at a large cost.
Sure, it's a large cost, but if the students are taking the AP courses and not passing the exam, then you're like, why do we spend money on that?
And we have I still think that advanced placement is certainly a place that we can continue to improve, but also I think it's an opportunity for kids. Like I would hate to take one away from the other. There's a different way they test. So the testing is very, very different with AP and with ACE. The ACE test have a large written component, and so kids who are very, very very, very skilled in communication certainly have a better opportunity in ACE to be able to kind of write a lot. You get credit for, you could actually get, and I may have to have Frances come help me, but she's going to see how good I do at this. But you get an opportunity to state an answer. It doesn't have to be right, but you can get points for reasoning. So it's a very different way of looking at the assessment in terms of ACE. An AP exam structure is, first of all, it's only one day, whereas the ACE is 2 days. So I'm going to give you arguments for either one. It just depends on kind of the courses. But certainly, it's not. I don't think that anybody in teaching, learning, and leadership would say that we don't want to have opportunities in all high schools, that any kid could follow a path. It's just, it is an expensive thing to do in all of them. So we had intended to put them in every region, but certainly, I mean, I did price it out. I can tell you that just to add 2 high schools if we want to add that next year, it's $500,000 to do Mount Dora High and East Ridge High. To also add on the Area Cole Academy, which would be the feeder pattern for that, and Cecil Gray, which were the 2 places we would add on to. We would do all those next year. I mean, 23, 24, if you wanted to add Lake Manile and Eustis High, it's another $500,000. And of course, then there's reoccurring costs for the other schools already doing it in terms of test and program fees and exam costs and diploma fees. And so there's certainly some pieces to it. But it's not, is it doable? Yeah.
I thought
it would just reroute us different. We were planning to go to the elementaries, into the feeder schools, and so that would take a little bit of a back seat if you actually wanted to push it forward into high schools, into all high schools.
I thought once they started testing in ACE like that and started getting diplomas, that it would start paying for itself. I thought Mike explained that to me at the Mr. Randolph.
It certainly can, but there's still some startup costs that certainly that definitely.
But the weighted FTE component, I think, is your question. Does that weighted FTE still exist for the ACE and IB?
I don't actually know that question.
Scott here? Yes?
Yes.
Yes,
Yeah.
it still does. So, yeah.
That was the idea.
Right. You
That it
get
would
the
pay
weighted
for itself.
component over time.
But we're just not giving it that time.
Right. You
We're
don't
adding
get
quicker.
at the initial.
Right.
But I guess, I just continue to think about students' introductions into AP so your first course, a quarter of your students are going to pass the thing. And then your sophomore year, you're probably going to take world history or biology. Once again, you've got world history, which is a course where like 26% of Lake County students are passing it. So boom, here's another strike against you. So now when you're registering for your class of junior year, you're like, do I keep going with this AP thing? I'm not passing the tests. Or do I start dual enrollment? And now I'm no longer even on a high school campus, and now I'm looking for education elsewhere because we can't meet their needs or not meeting them with the success that they're looking for. So that's and I guess, I can appreciate the efforts to expand ACE. I love that more and more schools have come on board with this. Looking specifically at my region, and Bill, you share it too, in Region 3, we've got one school in Region 3 that's got the ACE rolling out, and our 2 somewhat largest schools don't have it. They're still chasing the AP route. So I guess I wonder how much of this is a school decision and how much of it is a district decision to say, I think you need to look at this other offering for students. And I'm not going to say that you need to abandon AP altogether, because there are courses that are unique to AP that ACE doesn't offer. And so I don't want to take away those opportunities for students. But this offering, I think, is a piece that many students would take advantage of if they had the opportunity.
Do we still have our partnership with College Board?
We do. And it's a good partnership.
Yeah,
Certainly.
they do a lot in the feeder patterns for AP classes. I just don't hear very much about it, so I wondered.
We certainly do. So I think it's a conversation that we can have, Mr. Dodd. I mean, I'm certainly, like I said, we are not at all opposed to having that conversation. It just reroutes our plan a little bit, but certainly we can. And when you ask, is it a school-based decision or a district-based decision? Certainly, I think our college and career readiness department does a good job of planning out several years. I'm thinking about that regional piece, but I think it's a coordination of both. You know, I think we certainly want to have leaders want the programs to be able to make them successful, right? Because they do take some effort and some application and some time, and so we would definitely want to coordinate that with leaders too.
Yeah, I think, you know, when you just look at the data and you look at the number of diplomas being awarded in the two, you're at a disadvantage in the AP world where each test is a standalone. You get that. I mean, if you haven't passed AP research, then you're probably not gonna get the diploma. You're not gonna go back and sit for that exam again, right? When you're no longer in the course, or versus ACE when you've got this well-rounded perspective of looking at all these different subjects.
It's a different look, right?
Yeah.
They're different in pieces, yeah.
So the nine diplomas that we're citing here, those are all Leesburg, or
Yes, they're the only group of people that had seniors. And actually you actually get the interesting thing about the ACE is that you're pretty much done by your junior year.
right?
So
That's their first real year of data for students who have been coming.
Right.
So in their first year, they've got nine diplomas. Meanwhile, in AP Capstone, looking at 5 high schools who have been doing AP for a long time, they've only got 35. I think there's a significant unbalance there that, for me, it's ACE. ACE is probably the way to go if we're looking for an advanced diploma for kids.
we will take that under consideration and work on that plan.
You got a couple more slides, right?
I do, Next slide. So just to kind of let you know where we're at now, currently with enrollment, thinking about as we move forward, we do have a good majority, obviously, of our kids in traditional. Our virtual full-time enrollment's around 712. Our full-time traditional, this is only district-operated schools, so does not include any charters or any special programs, is around 36,664. And then I just want to kind of give you some opportunities to what's ahead. So if you go to the next slide, my last slide just talks about sort of some things that we're doing this year. So many of you attended summer leadership in June and know that we definitely relaunched the Common Vision for Instruction, knowing that we know what's best for kids, we know what opportunities all kids deserve every day and every learning opportunity. So we relaunched that. I think schools were excited to go out and relaunch that. They did a lot of work in the beginning of the year to relaunch it. We certainly are looking at our instructional resources, allowing them to be virtual and on paper. A Chromebook distribution is out. I think we did not expect the first 2 weeks to be like they were, and so the Chromebook distribution is out now. People do have them. We have certainly ordered. Dwayne Weeks and his department have deployed, I think 3,000 devices last week. It was an incredible number of devices that rolled in here that we deployed out to be able to fill places where we'd seen some growth or where we hadn't quite gotten kids to return them yet. So to make sure we had enough for people to be able to learn at home and have some seamless opportunities with Google Classroom as well as in person. And then our new ELA adoption implementation seems to be going very well. It is a challenging opportunity for teachers. Of course, any new adoption brings challenges to learning new ways of doing things, and so, but we are seeing some big successes and lots of support with that. We are going to continue to use APM as a part of our progress monitoring, and then to also that Lake Assist launch that I spoke about at the very beginning of today. I'm very excited to see how that supports kids as they continue to learn if they happen to get quarantined. And then knowing that our intervention acceleration has to be prioritized. We saw that in the data. We know that is where kids struggle. We cannot expect all kids to get learning at the same rate. And if we don't provide opportunities and time for kids to be able to get remediated or accelerated to keep kids on pace, I think we would be remiss and be doing kids a disservice. So certainly we are prioritizing that. We are pushing out professional learning communities. Summer leadership was also spent making sure that everybody had a great foundation. Certainly our director of professional learning with Leno Bonda is definitely working on that piece and providing some opportunities for people to have some facilitation and more work in the professional learning communities, thinking about how do we make sure that we are using essential standards and knowing what to do when kids aren't learning and being able to make sure that we are focused on every kid all the time. We have some new CTE programs. As you well know, we have unmanned aircraft at East Ridge High. We have the new aviation programs happening at Eustis and at South Lake, and then our criminal justice at Mount Dora High. So looking forward to seeing how those programs roll out in the upcoming years. So pretty excited about that. And then looking at our pre-ACE expansion, which I told you about earlier, heading into our middle schools and seeing how those can roll up and have some effect on our high schools. Any questions or?
Very good. Everybody good? Thank you very much. Outstanding.
We did very well this year and we should be proud.
Well done. Thank you. Okay. We're going to skip the order just a little bit. So we're going to get Mr. Johnson. We're going to go to you first. You got two things, I think.
Okay. So he had, just wanted to reiterate, he had sent the board an email, is that Friday? I think, just to give you an update on the Leon County judge ruling that said that the governor's current ban on mask mandates in schools are unconstitutional. But he did state clearly in that email to you all that while this has caused a great deal of confusion, until we have a final order and we know about any possible appeals or injunctions, that the law hasn't changed and the executive order does remain in effect. Did you want to add anything to that statement that you shared?
Yes, just want to let everybody know, I know that there was an interest in having a meeting to discuss moving forward sometime in the very near future, but at least at this point in time, we don't even have an order. The only knowledge of the judge's ruling is that he gave it verbally in open court, which wasn't really open court, it was a Zoom call. But he requested specifically that it be reduced in writing and not enforced until it was in writing. If you read some of the comments that different folks have made about the judge's proclamation at the trial, there are, if you would follow and enter an order based exactly on what he said, there will be some issues that created that have to be resolved, whichever way the judge's ruling goes. And I would assume, based on an article that I read about the governor's office response to the judge's ruling, that it's going to be appealed. And it's likely, I would assume, that the governor is going to ask that any change to the current state of the law be stayed until it is appealed. If that's the case, then we still have the proclamation of what the law is today is still the law tomorrow. It's still the law until we get to a point where we have an order, there's no appeal, there's no stay. That's what the law is going to be. So that's just a brief explanation of how this all pans out. It could be that the judge gets an order written today and there's a declaration that there's no appeal. If that's the case, then the law would change based upon whatever the final order of the court was. And if that happened, then you have the ability to be able to meet on shorter time limitations if that's what you want to do. But until that happens, I would just advise you, if we had a meeting tomorrow, I would tell you that, well, the law hasn't changed any from the last time that I told you about it. So you're free to take whatever action you want to, but if it's to follow what the strict limitations of the law are, those aren't going to be any different.
Would we know, once with the order, do you know immediately if the governor intends to
Get a
appeal
stay?
or get a
an
stay?
appeal?
Either way.
Well, there is a, I can't remember, it's 20 or 30 day time period for filing an appeal, but I got the impression if he's going to appeal it, he's going to do it quickly. I'm assuming they already have the appeal ready to go as soon as the order's filed. I mean, I'm assuming that because that's the way that all these other orders on these kinds of cases have come out in recent years.
What's status quo?
Ma'am,
What is status quo in this case?
status quo would be pre-judge's determination.
So,
It'd be the current state of the law would be the status quo.
because he put an injunction in place, what does that mean then? What does the injunction entail?
He requested an injunction to allow the status quo to remain, which was, there are issues based upon what the judge ruled, as I understand it. And I only read an article by somebody writing a summary of it. I didn't watch the 2 hours of him reading his thoughts. But if they would ask for status quo as part of the order, or in connection with the order that would be written, because otherwise you have some indecisiveness as well. The judge's order says this, do I have to do this? Is the Department of Education allowed to issue these emergency rulings on different things? Does the Hope Scholarship emergency rules stay in effect? So all those things are potential issues that come up. So I would assume that given past practice that there's going to be a request for a stay or an injunction, which is to not take any action until the appellate court, whichever appellate court they go to, rules. And I'm assuming that they'll attempt to go to the Supreme Court.
So this process will take how long?
Well, this last hearing, which I would have told you in normal circumstances, would have taken 3 months hurrying it. They did in 4 days. So obviously there was a sense of urgency of moving forward with it.
Okay, so I listened to the 2-hour thing, and I mean, you know that, we talked about it. And I mean, it seemed really clear to me that he granted relief to the schools and districts that had mask policies. That was he made that really very clear for the public.
That was what he was asked to rule on.
Right, so I'm confused on if he granted relief, why is there not relief?
Because somebody asked for the status quo to be maintained pending the outcome of whether the
Did they?
governor is going to take an
Who
appeal.
did?
I'm assuming so. I told you I didn't listen to the judge talk.
Okay, so,
I guess ultimately we need to see a judge's order in writing to be able to know what steps this board is even eligible to take next.
I mean,
That's what I'm hearing.
This particular
Yeah, which is supposed
judge
to happen
said
today.
specifically that the order was not going to be acted on until it was reduced to writing. He's the one that insisted
yeah, and
it
then
be
he,
reduced to
in
writing.
his 2-hour thing that I listened to, he said that he expected the lawyers to work over the weekend and that order to come out today, and that the state had 24 hours to respond, and then it would be written by Wednesday. So, I mean,
That would seem reasonable.
so would it be reasonable for us to have a meeting Thursday?
But if the
But if
governor appeals, then it locks it up.
If the governor appeals and they issue a stay, then nothing's changed for the time being.
So I have, we have a policy. This is, I just, you sent out an email yesterday with
Yes.
completely different guidance. I'm just a
I-
little
I
shocked
did, and
again.
yes, and Mr. Johnson, there was a couple of things. We can continue with a meeting. So one of the things that I was hoping to be able to do sooner rather than later, because I think it's important for the board and the community to understand, is that have been analyzing our student positivity rates. We've been looking at it by school, and I think that it's important data to share with the board and the community. I've also spent a great deal of time talking with the CEOs of all of our local hospitals. I've talked with our local epidemiologist and our chief medical officers with our hospitals just to understand kind of what we are dealing with as a community. And I do think that it's important to look at the data and maybe talk about some of my ideas for addressing some of the high positivity rates in some of our schools and how you do that surgically rather than sweeping, as we've been directed to do by the Department of Education. So, that is certainly something that I would like to do, in addition to, whatever the pleasure of the board is.
So just to be clear, Madam Superintendent, are you recommending that we go ahead with a meeting later this week, or are you recommending that we wait until we actually see the judge's order in writing?
Can I mention that, or speak to just a second?
Sure.
Because part of it also is logistics and
Right.
getting the facility. And I think that based on some of the situation we had last visit, that I wanted to move it over to the BCC, that we can only, I'm just gonna lay this out and then we can just talk about it. So I guess we're there, right? Okay, so we can only get, we can only get it on Friday. And we can get it, it's available all day on Friday, except that we have to be out by 5. And one of my concerns is it ought to be during a regular school board meeting where people are off work. So we don't have a facility, we don't have the BCC facility. So then, just putting that out there. So then where do we do it other than that? And I personally felt like I came away giving myself like a B+ on how the meeting went in here in maintained order. On Facebook, it did not sort out that way. But maintaining the control in the parking lot, which really was out of our control, that I don't want to see that again. So that's where my head's at. So I don't know if we, based on now what we're hearing also, that maybe it makes sense that if we agree we want to have a meeting, maybe just sort of the terms of it, that we want to have a meeting for sure, that we want to have it at 6 o'clock where the public can attend, if we like get the base, and then as soon as we can call for a meeting, then we organize the facility, Natalie, and then we're, at least the mechanisms in place for us to move ahead with it. Does that sound reasonable?
No, because we're an emergency and that's weeks away.
No, it may not be weeks away.
Or
it could be weeks
How
away.
many thousands of kids were out last week? 4,000? Like, this isn't sustainable. We are killing our teachers. I have doctors begging me about how bad the kids are getting sick. My family, my extended family runs a pediatrician's office. They've opened tents to try and deal with the overflow of kids. Kids are getting really sick and they are scared. I don't understand. This is, to me, a moral issue about life and death. And we are orphaning children and we are letting this run rampant. I don't understand. This is not about me as a Democrat in any way. This is about me as a scientist looking at the reality of what's going on in our community and the fact that we apparently are just all pretending that our hospitals aren't full and crammed. Our children are being transferred to pediatric, like advanced pediatric hospitals. The local pediatricians are calling in pulmonologists because they don't know how to treat these children. And everyone is telling me this is not an emergency. I am telling you, from my morals and my own ethics, something is wrong in the state of Lake County. I don't understand what is going on with all of you. Like, this is a problem, and everyone's in denial. I am just blown away. I don't know how better to do it. I can explain to you what happened with the Department of Health and how corrupt they are if you would like. You asked about the testing situation last year. Let me explain what happened last year after that man came to us to offer testing to everybody, because I realized 2 weeks ago, or several weeks ago, that you had never been told. Well, let me explain. I went to the Department of Health trying to find out if that was a valuable test. They refused to give me information. I went to the CDC. I couldn't get a hold of anybody. I went to the FDA. They refused to give me information on whether or not that was a valid test. Our Florida Department of Health, I called them. They refused to give me information, including up to the state of Tallahassee.
Our Department of Health is run by our governor, period. I then had to use my connections to finally reach out to the University of UCSF in San Francisco and finally got a professor to write back to me that those tests were complete garbage and were not doing any good to use them. I then have all of this in writing, and I'm happy to make it public and give it to all of you. I then went to the superintendent and tried to pull us out of this, and we went back and forth with the person that I tried not to ruin his local business, and he refused to pull out. Eventually, a picture came out where in the newspaper where that office was doing the testing procedures with the nose and everything, which is an aerosolizing procedure right in the middle of the mall with no masks, no gloves, nothing that is even considered proper medical technique. At that point, I lost it. And I said, we in Lake County Schools cannot be associated with this fraud anymore, and pulled us out. I was not able to get this county out, even though I did let them know. I couldn't let the county out, get the county to stop using that person at the mall until Christmas, when it hit my dad, because some of his employees went there, and then he had to shut down his entire business for false information. It was false tests. I have very little faith in our public health department because of that situation. I had to personally reach out. I had contacted the company who was lying to me. This is my field. This is exactly what I do. And that was complete and utter nonsense, what they were doing. That's at the point where I reached out to the University of Florida to try and get an independent person, because that's how scientists work. We look for when people tell us that things are false, we look for proof, and it's very hard to prove that something is false. But I managed to do it. It took a while, a solid week of just digging and finding people. And I'm seriously concerned. Our health department will not step up and say anything about what's going on, but all of the doctors and hospitals are screaming at us. And yet, we had a circus meeting instead. So I know that public health isn't a popularity contest. We have a problem in Lake County Schools. We can't keep doing this to our teachers. They are sick. I'm done. If we don't call an emergency meeting now, then we don't have an emergency. And you guys just need to just say, you don't want to do this, and I'll give up. But you have 400 parents that formed a group on their own last week to try and deal with this, and tried to come and talk to you, and were stuck out in the parking lot and couldn't even come in. And now they're too afraid, and I know they're talking to all y'all, they're too afraid to come because the 3%ers are showing up and telling them that they were at the, that was in the newspaper, and I'm speaking, Vance.
Excuse me. Let Dr. Burns speak.
The 3% showed up and absolutely intimidated those people on purpose. That was embarrassing and a failure of our democracy. We disenfranchised those people.
I think, as I'm just kind of listening to all of this, I think one of the things that you've highlighted is that this facility is grossly inadequate to contain the meeting that you're asking us to hold and that people are requesting. I share the same concern that while we were able to maintain decorum to a rather significant extent here in the boardroom, there is so much going on out there, which now we're getting blasted for. Of, the 5 of us are sitting in here. I mean, how could we be in the parking lot in the meeting as well? We can't be in both places. So we need to have a facility that is adequate for the number of people who are going to want to be at this meeting, and who would like to share their opinion and to do so in a public input forum. So, not only is parking a concern, but the capacity of the room and to be able to have the support of law enforcement available as well to handle that kind of crowd. Based on what we heard when we heard people hitting others, spitting on each other. Clearly that no matter what the issue is, that behavior cannot stoop to that level. We've got to maintain civility. So with that, I support the idea that whatever meeting is held needs to be in a place that is adequate to hold that meeting.
But do we want to check, we know that it's impossible this week, because that was the intent, but to sort out what's available for next week?
What about Lake Sumter? We always have the legislative delegation there. I just can't imagine. I don't understand why you want another 4,000 kids to go home this week. Nobody's getting education.
They have a big auditorium.
They have a big auditorium. That's not a bad idea.
I mean, and Leesburg High has a big auditorium.
We didn't, again, we wanted to try and have it where it's not necessarily on school campus. I mean, that was sort of we said to them, not
okay.
have it at a school where people can get in the hallways and stuff like that. I mean, you have to go through but they have that whole separate building at Lake Sumter. We can call.
Yeah,
But then I don't know what we meet, that then if we meet and discuss, then are we saying that it's all depends on how the courts rule? Because I'm not going to go against the law. I mean, I'm just not going to do that.
Yeah, I think the other part is that then our discussion becomes hypothetical until we've seen a judge's orders reduced to writing.
Which is typically you want to meet and then take action. But if we meet and then we all have this conversation, and then it's dependent on, what do you think?
I think that we have a very dire situation with very passionate people on both sides. And I think anytime you have that combination, it's very important that we all stick to making sure that we're civil and that we consider all of our obligations in as much as we can, a calm manner. I think we're all agreed that at some point, perhaps sooner than later, we'd all like to sit down and discuss this. But I think there are some actual things that are issues, such as a building that's large enough, having it at a time when our constituents can be there. When I sit up here, I don't sit up here as a member of any political party. I sit up here as a person who wants to be on the decision-making end of trying to make the schools better. So I'm really having a hard time when we attack each other based on whatever our party affiliation happens to be. So I really would hope that we can get away from that and we can really focus on doing what is right for the people who elected us to come here and make those decisions. So with that said, I certainly support a meeting. I think we have to be cognizant of what we're meeting about and what is within what we can do. We don't know that right now. But Dr. Burns, I absolutely get your passion. I hear you, I understand. But sometimes, you know, we have to work within the perimeters that we have. And I know that's hard, but sometimes that is. So I think we need to find the earliest time that we can meet in a place that will accommodate us and meet all the criteria that we think is important. I think you have a very valid point, Mr. Dodd. It needs to be big enough. And we do, Mr. Mathias, I think need to have clear boundaries of what we're deciding. Otherwise, we just get more of what we had. We get people that become very upset. We know that, you know, passion runs high. And I shudder to think that probably whatever we decide, there's going to be someone that's unhappy. And I don't want that. I want us to make the best possible decision that we can make for the people that matter, the people who are in our schools. So that's what I think.
And I feel like that we already did vote and we had a direction based on the law. And it's important that that first, whether it's settled one way or the other, and then certainly then an opportunity to come back to the table and discuss. If we get local control, which is the way it kind of should have been to start with, then we would have already had this and we would have had it before school started and we'd be moving forward. And so I think that we explore the facilities, see how, get some availability, Natalie, if you don't mind. And then at the earliest moment where we can affect change. I don't think it just matters just to meet again. I mean, with what we had the other day, we already had a vote, and so them coming wasn't even agendaed. So it wasn't something we were taking action anyway, and yet we got all that emotion, right? So let's do it at a time and a place that can accommodate safety and security, and that we can actually vote and affect change if it be whatever that majority of the board vote is. Is that okay?
I already told you what I thought.
I know, but
I mean, I don't know what to tell you. I think that y'all are stalling. And you don't want to, I think you're stalling. It's
Okay.
pretty obvious.
okay, well, I'm not going there because we're
That's
not.
fine.
Okay, all righty. So
So
that's what I think. Is that,
So, just so I understand, I think what you said was, we're gonna check for the earliest time that we can
we'll
meet.
get some dates, but not meet until we know what we're meeting about and that we can take action.
Okay.
That's what I sort of garnered from your
Yes.
opinion and Mr. Dodd, and we know Dr.
Do we
Burns.
know if we have any legal authority to take any action on anything in quarantines? Because our quarantines are
Okay.
still not following
Okay,
CDC
so
guidance.
now then, that is one that is terrible, but that's under another executive order, because I said we should be able to talk about the two of them. Regardless what happens to the governor, the Surgeon General's executive order is still in place, which is the one that's affecting the quarantines. So right now, we don't. And there again, it is as passionate as you are about that issue, equally, I'm passionate about the fact that we have 400 kids out last week, but we have 2,600 on quarantine last week. The quarantine is far worse, in my opinion, as far as affecting students and their families than actually those kids that are sick.
Yeah, doctors would agree with you, disagree with you.
Well,
That
actually,
is so offensive, Bill.
Actually, I talked to Dr. Hussein and he said that was an issue. I talked to him Sunday.
Is he a pediatrician?
Dr. Hussein?
I like him a lot, but he's
No.
not a pediatrician.
Well,
And I'm telling you, the pediatricians here are scared.
actually, Dr. Hussein, you know him, pediatrician?
Hussein?
No,
Hussein.
Hussein,
No.
U-S-O-N.
No,
He
but
was
I
both
do-
my son. He doesn't believe in any of this mask action. So he's a pediatrician.
Right.
So we're going to go tit
But
for
I don't
tat.
care about your friend Bill. Like, Bill, your
I don't care about your
friend.
friend. You know what I'm saying? We can't argue.
people
We
aren't-
can't, and here we have to be civil, please.
I'm
Please.
trying to be civil. And you're telling me that life and death situations aren't worth it.
How many kids are
How many
in
kids
intensive
have
care
been
right now?
orphaned?
In Lake County,
Children don't go into intensive care in Lake County
bingo.
because they go to Orlando.
How many are in
and
Orlando?
Tampa.
Last time you said a number that wasn't accurate. What's
Last
the
time
number
I
now?
didn't say a number that wasn't accurate.
You said you and
None
Stephanie.
of my numbers
You
were
and Stephanie talked about that.
inaccurate.
You and Stephanie
They
talked
came
about
out
that.
in the newspaper the next day.
How many kids from Lake County are in
Why
intensive
don't
care?
we ask our Florida Health Department, Bill? We
the
should be
superintendent
having
the superintendent has a
guidance.
meeting. Oh my
We
goodness.
have a problem
We 100%
with
agree
no
with that.
guidance.
100% agree with that. 100%. The health department in Lake County has let us down tremendously. 1,000%. So we found common ground. Let's stick with the common ground right now.
That's actually a good point, Bill. Fair enough. Like,
I got a
then
question.
can we pick a university to give us some guidance?
So when we have this meeting, I think it'd be beneficial if somebody from the health department were there to represent, because I'm sure we'll have some questions along the way. Is that something that we might be able to get support from?
Yeah, so I do have some of this data. I have, as I said, I have spent a lot of time talking to the CEOs of our hospital. I've been collecting some of this data. I do have some of that to share in terms of what they're seeing, and I can, and she's right. The CEOs of the hospitals are very concerned about their staff, and all of them said to me, "We're tired. We're exhausted." You know but the good news is that they are beginning to see some trends. And some downward trends, and I think that we see that happening here locally, and that's what they all shared with me. So I do have some data. I do have another call today, and I do have a meeting this afternoon with the Department of Health. So I am trying to collect enough data so that we can look at what we're dealing with as a community, and then what is happening within our schools. And I do think that that data is very important to look at. And then how we might go ahead and address that, because to her point, I don't think we need to wait in cases where we're seeing some very high positivity rates within schools. I do have some suggestions about how we could go ahead in the short term and go ahead and address some of those things, still in compliance with the law, but also making sure that we're taking care of our staff, we're not overwhelming them. And I can tell you from talking to many, many teachers, it is the quarantines that's killing them. it is very hard when your class is constantly being disrupted by kids being pulled out of class and going into quarantine, and then they're coming back in, they're quarantining again. And so it's not good for kids. Yesterday, I spoke with Commissioner Corcoran because I'm very concerned about the quarantines and what are we doing about that and what are our options. And he said that September 15th, the new Surgeon General will be coming in, and that their first order of business is to look at the current Surgeon General ruling and make some revisions after consulting with the new Surgeon General. So he said to watch for some differing guidance coming in mid-September. That's a little ways out, and again, I don't know that we have time to continue to wait as kids continue to be in quarantine, but I don't know that at this point there is nothing we can do about the quarantining process. It is in law, and we have to follow the law. As we keep saying, we're not going to pick and choose the laws we're going to follow. We've said before, if we could do one thing, it would be to fix the quarantines. But the way we're going to fix the quarantines right now in the short term, since there's nothing we can do about it, is to reduce the number of kids that are positive in our schools, because those rates that are then impacting the quarantine rates. So I do think that we do need to meet. I think that it's important to look at this data, to look at some of the suggestions that I have collected from others, and see if we can't come up with that surgical approach to dealing with issues, still remaining in compliance with the law.
So are you suggesting a meeting or a workshop to look at data?
I think at this point, I'm not sure what action the board can take, so I would definitely want to schedule a meeting, whether that's a special meeting or a workshop. I'm not sure that it.
If you wanted a workshop to look at data, we could do that in our own facility and by our own time.
Mr. Chairman, may I make a suggestion?
Yes.
I would like to suggest that we have a meeting, knowing that we may not have the necessary information to make any decisions, but it would give the superintendent an opportunity to share with us the information that she has from her conversations and research that we don't have.
That's what I'm hearing.
And
Yeah.
I would further suggest that since Friday, the courthouse is available, and we don't necessarily need public input. I mean, we certainly want it, but I think it would be appropriate to go ahead and meet in the morning, because we're preparing ourselves to be able to make a decision when it's appropriate.
So the BCC is available in the morning on Thursday. It's available from 8 to 2. I know that I'm not sure that was the preferred time, just simply because there are working parents that wouldn't be able to attend. But if we are just having a discussion, although I'd like the community to see the data, we can certainly make it available through other means. So we can use the room. I had Ms. Challenger check anytime from 8 to 2, and then they have another meeting in there after that on Thursday. So we could do it on Thursday.
So 9.
So Dr. Burns,
9:30
are you
to-
amenable to that?
Yes, that would be very good.
Okay, so we want to do Thursday at 9:30 to 1:45.
Okay.
It's time. There will be no action.
So is it a special meeting or is it a
Are you
workshop,
okay,
Mr.
Mr.
Johnson?
Not taking any actions in the workshop.
Well, but do we want to have the ability to take action should something change?
I would think yes.
So
Yeah.
we wanted an actionable workshop.
No, you want to call it a special
Meeting. So we'll schedule a special meeting at the BCC on Thursday at 9:30, you said?
But how much information do you have to give? Never mind. I'm just adding time up. We're fine.
And I am going to request that we do have some other folks there to help with the data. I am not the expert on what's happening outside of the school district in terms of what's happening within the community. So at the meeting with the health department, I will ask for a representative to come and help share that information so that you have it both from our internal lens as well as external as well. And then the information that I'm able to share that I was able to get from our hospitals.
Okay.
Very good.
All right. Attorney comments?
Yes, Mr. Chairman, we have a employee who's been terminated on the basis of being absent without leave, who's requested a hearing. As you recall, the options are retain a hearing officer from DOA or go have the board hear it as a whole. Should be a very short presentation. He is represented, and we'll have to retain somebody to represent the superintendent in the hearing. But my recommendation is that we have it because we can do the whole process, I think, in an hour or less, based upon what I know about the issue today.
So you're asking
Well, I'm
if we want to
asking-
hear it,
Yes, sir.
or do y'all have a problem? No, it's
And
fine.
it saves some money with the hearing officer too.
Okay.
Okay, thank you. That's all I have.
Okay.
Can I make one other comment in regards to the BCC? I did ask Ms. Challenger when she checked on the time to check on the availability of virtual public input. They do not have any ability to provide any public input virtually in that building. Of course, it is streamed, live streamed, but so that's going to be a limitation. So what we might want to consider if we have public input, they could email it to Ms. Owens, the website they've been using. You could give us that website again, we could put that out there. They could actually submit it in writing. That could be read into the record if we have folks that want to provide it. That would be the only way that we could do it.
Okay, with that caveat. Anything
Is
else?
that something we will do?
That we will do what?
Is that what we will do, or is that just what we could do? Are we gonna do it?
Well, if we're going to have it at the BCC, we can't have Zoom.
Well,
So they
but are
can
we gonna
provide
need
the
it into
public
the record?
input in writing.
Right.
And be
Yeah,
read
of
into the
course.
record, yes. We'll
That's
put that
reasonable.
information out.
So every email that she gets on this topic, we're gonna read that out loud? Is that what you're saying? Have that read into the public record?
Usually don't read them all.
Can we just
You
bring a
can do
computer
that
and
if
put
you
it in
want
front of a
to,
microphone?
But putting them in give them to Natalie, and Natalie keeps all of them, so they're part of the record.
We won't read every email.
Unless you have a need to orally read.
Let me, in the Neola policy, is it 101.0, 165, 169, either 1.1? Anyway, with the time limit on the 169, with the time limit of 30 minutes for public input, that again, depending upon if we get people to show up, I would increase that to some limit, but I'm going to be monitoring the time that we have the facility. At the same time, we had that policy that was put in effect when we had, during the pandemic, that never got repealed, which is the one about the Zoom, which we need to deal with that, to be honest. I thought it expired with the executive order expiring, but in research, it did not. But at the last meeting, being fair, I completely forgot about that we had Zoom because we haven't had it in so long, and we ended the public input. At that point, I was going to let them read their name into the record. We could almost do the same thing, that if we run out of time and we have Zoom emails, that we could read their name and their position into the record and not read the entire email, right? So that's what I intend to do, so. And then we're going to deal with that whole Zoom thing anyway, at some point. Okay, so is that all about that? Dr. Burns, public input, board member comments?
No.
None? Mrs. Cunningham?
I'd like to thank the staff for the presentations this morning. I think we have a lot to be proud of in Lake County. And while we're not perfect and without problems, we certainly have the ability to work on those. And I would just like to say that I heard a lot of things today that make us not just a good district, but a district of excellence. And I would like to thank the staff for your contribution to that, because we realize that you work very hard. And I would just like to reiterate to my, I guess, everyone, and especially to my constituents, it is very important, I believe, to each of us on this board to try and make the very best decisions that we can make. I don't think any of us take this lightly. I don't think any of us have the attitude that, it doesn't matter. I think it is because of the seriousness and because we know that people have such strong feelings on both sides. I think that's why we weigh all this. And we spend, and I know I do, I spend hours each night reading the emails, which is why I kind of chuckle when Mr. Dodd asked if we were going to read them all out loud, because they're a lot. But they are important, because that's the only way people have of letting us know how they feel. So to constituents, thank you for your input. And certainly we will continue to try to make the best decisions that we can.
Yes, I think you kind of read my mind on the thanks to the staff as well. That I think one of the things that just really as a parent, when you get that many folks come before us with such complicated topics, is that you start to understand just how complex a school district is. It's not just about stepping into the classroom and teaching kids how to read or do math, but when you start talking about their mental health and their safety and their security, and each of those topics alone is a complicated one to begin with. You put all that together, man, what a machine we've got. And yeah, so it's amazing that we've got a group of people who are just so passionate and dedicated to see that come to be.
And I'll just tag on that it's also a testament to the citizens of Lake County who stepped up with the 0.75 millage that really made this all pretty much happen, and happen with the fidelity that we could really touch students, and the numbers tell the tale. And if we saved one, that would have been enough, right? And that's where my heart's at. I want to address some of, obviously, a lot of passion, but Mrs. Cronin started out with speaking about how the meeting was run, and I own that. To every one of you here, I own the procedures and the processes. I didn't know what was going on out in the parking lot, but we had the Tavares police, we had the sheriff there, and there is something to be said for First Amendment rights, and whether these people are screaming, which is offensive to me, that is apparently their right, or the police would have done something about it. That it was on Facebook that I was stacking the deck about who was able to speak. That is 1,000% true. What is true is that I separated the cards as they came in. What did I say? Oh, it's 100% not true. Okay, let's take that back. 100% not true. That I separated into 3 stacks. One was people that wanted their names read into the record. And then I separated those that I could tell, because not everyone said what they were in favor of. But I tried to separate them into 2s, and my intent was to call one after the other. So it would go like this. With the crowd outside, then it dawned on me, there's no way that we can wait for people to be called in, or it would take all day. And so I decided to go row by row. I had no idea where you stood, and I would find the card as you came up to speak. That's what went down. So there was no stacking the deck. We brought everyone in. That at the end, our policy calls for 30 minutes of comments. In the interest of giving people time, it's my role, I extended it to 1 hour and 30 minutes. At the end, we had probably 10 that did not get to speak, and I allowed them to come to the microphone, give their name and their position. I don't know what else to do. 1,000%, again, I forgot about the Zoom folks, and we had 4 of those. So to them, I apologize if they stayed on for 1.5 hours and then felt like I ignored them, but 100% I ignored them. Now that one is true, because I just forgot about it. So that's how the meeting went down, and I felt like in the boardroom that everyone did respect each other, and this board, for the most part, respected each other. And that's what it's about. It's civility in the face of, when you touch someone's child and you see, and Dr. Burns, that's why I understand your passion, because you have children and you get it, and we have children. And the one thing that we've shown today is our commitment to our kids with their mental health. Why would we not, why on this planet would you think we're not concerned about their physical, right? So, so we will get through this together, and we'll get through it as a unified board, and we will do what's right for kids. And it is not political for anyone on this board. I can tell you from my heart of hearts, even though the accusation is that it's political. What I did see was, I did see a Facebook notice first, where the Democratic clubs were organizing a rally. About an hour later, the REC called me, and I told them not to come, that it wasn't something we were voting on, and not to come. It was a waste of time. That's what I said. They called me a bit later and said, we're just letting you know we're coming, but we're not going to talk. Well, that was a big old story. anyway, that then I saw jumping times. We're going to be there at 5:30. Then the next group would post, we're going to be there at 5, then 4. And it was due to jump on the media coverage, not about our kids, seriously. And not that they don't care about them, don't misunderstand, but it was positioning. And that is a shame that that happened under those conditions, in my opinion. For our community, it's a shame. And as far as there were allegations on both sides, we're better than that. That's all I'll say about that. We as a community are better than slapping or spitting or yelling or cussing at each other. We just are. So with all that said, that's about enough. Meeting adjourned.